44,000 or almost 45,000 employees. And over the next 10 years, at those two rates I mentioned, that 1.7 and 1.7%, you'll see a net increase in residents of about 14,000 and a net increase of employment of about 3,000, a little more than 3,000. So beyond just counting the residents, we do actually have to understand for a house or for a given commercial establishment how many residents or how many employees will be in those establishments. And so we have something called occupant density. For the categories of fee, we use the existing categories from the existing fee program. We use the American Community Survey, city building permit data, as well as ITE data. I think that's the Institute of Traffic Engineers. It's a nationwide database used for traffic studies, but also estimates employees by type of commercial development, say retail. A typical measure is how many employees per 1,000 square feet, for example. We use all those factors to estimate here in order to do the calculations for the P program. And here you can see the estimates of occupant density. For residential, you can see the sort of bands of, and these are square feet, so 900 square feet or less up to 2,100 square feet or more, and a corresponding persons per dwelling unit. And that's a way to measure sort of the impact, because after all, it's not the homes themselves that cause public safety impacts, it's the folks living there who need assistance or make a phone call. And so the more people who are living in a home, for example, the higher probability that someone in that home is going to make a call or need services. The same goes for non-residential. There you can see it varies by use, and it's employees per 1,000 square feet, with the exception of hotel and motel, which is employees per room. And that's the same idea. The more employees are there, the more activities there, the higher the likelihood that for a given 1,000 square feet, of course, things don't get built in 1,000 square feet. It might be 5, it might be 10, depends on the size of the establishment. But that's a way to estimate sort of how much of a burden a given type of non-residential development will be on public safety services based on the density of employment there. So in addition, there's a capital improvement plan. I think we showed that to you before, but basically it's the sort of things that the money is going to be spent on. It's part of the Nexus study that we put together. And it's important that because this is linked to new development, because it's about mitigating impacts, it isn't just sort of a wish list of stuff you want to build. It is actually things that expand capacity. You can't be replacing or rehabbing existing things. It can't pay for operations costs of any kind. This is a capital facilities plan. And there are a couple of specific rules for New Mexico. The facilities have to cost at least $10,000, last more than 10 years. And in working with the departments, these are all the facilities you'll see are all facilities that are identified as things that are needed to maintain service levels as growth occurs throughout the city. So here you can see the draft capital improvement plan. It's a lot of buildings and a significant number of vehicles. If you have any questions about this, the fire chief here, he can offer any details you want, the police chief as well, about the items here. And I can go back to this. We can ask questions, and feel free to ask questions as I'm going through this. I think you all know that, but of course we can go back to whatever you want to go back to once I've finished.
Yeah, Mr. Edison, we prefer to probably get it done completely, because if we do it in stopping, you'll never get done.
All right, yeah. Fine. So using all these factors, the capital plan, the existing facilities, these factors, we basically put together a public safety impact fee analysis that calculates what the fee is, the fee per unit, based on the size of the unit, or the fee per square foot for commercial. We're using an existing facility standard, which basically looks at the facilities in place now to serve the public and the relationship between those facilities and how many people and how many employees are in the city now. That gives you sort of a rough relationship of what it costs in facilities terms to serve the public. So then looking forward, if you add a person, if you add an employee, proportionally, you know about how much it'll cost you to do that, how much it'll cost to provide those additional facilities. So we use that existing standard, and then in order to estimate the relative impact of commercial and residential units, we used actual call data. We looked at the types of units and how many calls, types of development, and how many calls they generate based on both police and fire calls to get an estimate of the sort of relative burden. And then finally, you'll see there's 2 fee schedules we calculated. One matches the current land use categories, and then I think at the suggestion of the CIAC, we also did a sort of a simplified one that consolidates a couple of categories that's just for simpler administration, essentially. So here you can see the service population. This is based on that the growth factor I mentioned. And the other piece is that in order to estimate the sort of overall burden of the whole city, both employment and residences, employees and residents, we have to actually combine them because they together are creating demand for services. So that worker demand factor is actually based on that service call analysis, where we looked at sort of for a given employee in a business and for a given resident in a home, what's the relationship between the number of calls that they generate. And we saw that actually on a per worker basis, workers per worker generate more calls than residents do. And this is looking at the relationship essentially between commercial and residential developments. So you can see there, what we get to eventually is this service population, which is sort of all the people getting served, but we weighted it because, as I said, workers on a per worker basis place a few more calls. And so to add them together to get the service population, to calculate the sort of cost per service population, which is that number I mentioned, which is our estimate of the capital needs compared to how many folks live in the city or work in the city. You can see that the residents, those resident and worker numbers and the new development numbers are from the earlier analysis I showed you with the census along with the growth rates. That's where those numbers are from. And if you combine that along with this worker demand factor, you get that service population of 186,000. That's a number you'll see in just a minute here in the next slide, or one after that. So this is the existing inventory I mentioned about. The other list I gave you was the CIP, which are the planned facilities. These are all the facilities, the public safety facilities that are in place now. The things that are serving existing residents that are sort of the investment, if you will, that the city's made to date in providing these services. So in order to estimate a cost per capita, we take that existing public safety facility, which is a number you just saw on the slide before. It's all the existing facilities. The existing service population, which was 2 slides ago, which is the combination of employees and residents. And there you get essentially a facility standard per service population, a cost per capita of both employees and residents that it costs to basically provide police and fire facilities. And that is, if you will, an estimate of in the future, every time development, commercial or residential development brings an employee, brings a resident to the city, that's an estimate of what it will cost to provide the public safety facilities that are needed to serve them. And you can see the per resident and per worker are different because it's there's a 1.0 weighting versus a 1.27 weighting. So with that, you can see that existing facility standard per capita, the 497. The service population growth. And service population, again, is the combination of residents and employees. There you get the sort of total estimated impact of your revenue over the next 10 years through 2030. So then based on that factor, we then can calculate a maximum justified fee schedule. This is the schedule based on your existing fee schedule. That is, the categories are all the same. You can see there's a range of residential sizes as well as non-residential categories. And then we also did an alternative fee schedule, and all it really does is it combines the warehouse into one category and also removes the 900 square feet and less category, which I think based on building permits there haven't been any of those built in the last few years. So the idea is to combine, have one category that's 1,300 or less as opposed to making it more fine-grained than that. They're both perfectly acceptable. It's essentially a policy decision. They both are calculated the same way. They both have the same nexus. It's a matter of administration and sort of what makes sense. And then finally, here's a comparison to current fees. You can see the current fee schedule on the left, and then there's the maximum justified draft, which is the first set of fees, which is based on all your current categories, and then the alt is the one with the couple of compressed categories. And you can see basically across the board, the fees go up by a bit. That's not surprising. I mean, usually costs go up. That's the usual trend. Some go up disproportionately a little bit to others. Some of that's because the methodology we're using is different from the methodology in the last time the study was done. I think I mentioned that the last time I presented to you. It was unusual. This is much more standard. This is what we do across the country in terms of how we calculate this. And with that, it's the end of my presentation. Happy to answer any questions. Thank you.
Very good. Thank you. Mayor Pro Tem, Councilor Curran. Okay, Councilor Curran and Councilor Graham. Sure, go ahead.
Okay, thank you so much. I really appreciate your presentation and the coefficients that you've included as far as what we need to consider. And so I just want to get a picture for, it seems like we've underestimated our public service impact fees and or needs by like $26 million or $17 million. I'm trying to
Oh, you mean
figure
the
out.
26 minus the 10 roughly?
Yeah, historically. So we've been underselling ourselves, both in terms of estimating what we need and estimating the number of new dwelling units that come in. So I think it seems like the things that you project will then, it seems like it will only cover about a third of what would be on our CIP for public service necessities. Is that accurate?
I think roughly it might be a little more than a third, but essentially, yeah.
Okay.
Yeah.
So I say this as, again, I live in the district where much of that new growth is occurring, and I really do firmly believe that if folks want new houses, part of that is really paying our fair share to build the services there rather than distributing them across the city like we might in the case of things like using GO bond funding to fund public safety things. So I would ask, so this it seems like it's based on all of the sort of research that you all have done, but we underestimated before, I think, to our literal and figurative deficit. I would rather we not overcorrect, but get us closer to what our actual needs are if we're going to implement a change. And so I don't know if this is all the market can bear, if that's sort of where this comes from, or if it's just based on sort of actuarial norms, or where does this fall in that? And as a policy body, can we possibly be a little bit more proactive in thinking about how we apply impact fees generally, I would argue, for all of us, and public safety ones in this case?
Right. Given the methodology we're using, which is using an existing standard, so looking at what you have in place now in terms of facilities and the relationship of those facilities to your current population and employment, what we're presenting to you is a sort of maximum justified fee you can charge based on proportionality and nexus. Now, there is potentially there are more aggressive ways to do it that are more speculative about future development. But we find, especially for police or public safety services, because it's a whole system, it's pretty hard to fish out future development, future improvements, future facilities that are only for new development. Because really, every time you build a new fire station, it's kind of for the whole city, and maybe not quite, but they cover each other. And so it's very difficult to say to new development, this new fire station or this new facility is entirely your responsibility. It's often sort of a shared responsibility. And so that's why we often use this other methodology, saying, look, we're not going to get into exactly who's served by each station and exactly how much of that's new development, how much is not. We say, no, we already know our existing system is in place, it's serving the community, and we treat that as a proxy or an estimate for future costs. Now, what is true is that over time, things were always surprisingly more expensive in plans, and there's a political process for what gets built, and I mean, that's all above my pay grade. But in terms of the way we do the calculation, this is the most conservative approach, but we are offering you the sort of maximum justified fee that you can under this methodology.
No, thank you. That totally answers my question. I appreciate it.
Councilor Graham?
Thank you, Mayor. Can you return to slide 13, please?
Yes.
Yes, perfect. So just trying to make sure I understand this concept of service population, using myself as an example, and stop me when I'm wrong, which may be really quickly. I am both a resident and a worker in this formula, right, so far? So when I'm Becky Graham at my house, I'm a resident. When I'm Councilor Becky Graham here at City Hall, I am a worker.
Yes.
And I am cheaper public safety-wise when I'm at my house than when I am at City Hall as a worker.
On average, I mean, you in particular, it's hard to say, but on average, yes.
Okay, great. So I think I see the number 186,383, and I think we have this narrative in our mind like, oh, Las Cruces has 100,000 people, and I stumbled over that for a moment, but okay, that using myself as an example, that helps. So thank you. That answered that one. And then slide 15, please. Thank you. And that 497 and 631, is that a per year, per person? What's the
Well, that's-
reference point?
Those are, the 497 is per service population, which also is per resident, because resident is the baseline. And that's the sort of total cost when, say, a new home's built and it's got 3 new residents in it. It will cost, based on your existing facility standards, your existing relationship between the equipment and the fire stations and everything else compared to your current population, to stay at that same relationship, then for those 3 new residents, you would need to build $1,500, roughly speaking, of new facilities, not annually, just as a one-time charge. This is a one-time
Right.
charge at building permit that you'd have to, that it's going to cost that. Now, there is no item, there's no line item of $1,500 for that house. It doesn't work that way, but this is an estimate of sort of, in the aggregate, when there's enough new houses, you need a new ladder truck, you need a new station, you need to expand something, you need to make, all the things that are on the CIP list. You start to need to do some of those as they accumulate. Does that make sense?
Yes, that helps a lot. And presumably somewhere in all of this math, I'm sure there's way more math that you're keeping behind the scenes because it's already a little overwhelming as it is. This factors in the fact that we have an aging population. Generally speaking, I think across the nation and certainly here in Las Cruces, we're getting older on average, and I'm sure that has an effect on public safety impact fees and how much it costs to service the population. Is that kind of thing all worked into your?
No, it's not. I wouldn't say that it is. 'Cause
Okay.
we're using, in terms of the future population, we're using those, from your own plan. We're using that 0.7% and 1.7. I may be misquoting it now, but those 2 growth rates. And for the sort of estimated cost of providing services, we're using what's in place now. And now the CIP reflects, and that may be where some of that delta is, right? The CIP reflects sort of what you're going to need, and as has been noted already, it's not all covered. And some of that may reflect that shift. The calculations we do don't take that into account.
Okay. And I think, oh, yes, please.
Mayor, Councilor Graham, Fire Chief Jason Smith. So the weighting of the call volume is where I would look to a place that says this explains where we're going in the health of our population. As we respond more to residents or residential occupancies, that reflects an aging population, a less healthier population, or a healthier one, if we're going to be positive, right? And then the worker is actually per commercial. So it's like a representation of commercial property. So when we first started the analysis, before we had all of PD data in there, the residential side was weighed much more heavily because fire department, on average, we respond to people's homes more often. Police department actually responds to commercial occupancies more, which is why the workers have a heavier weighting. So as our population demographics change, our call volume will change, and then that will reflect in the weighting of our residents versus commercial properties.
Okay, great. Thank you, Chief. And I think, yeah, that I'm probably I'm adding on to what Councilor Coran was mentioning. She and I are the 2 new people here, and I think in several situations, utilities rate increase, for instance. We're facing some situations where we maybe have a little bit of sticker shock because we tend to maybe not revisit these issues as frequently as we should. So I just add my voice to, I totally believe in your math, but yeah, add my voice to saying fine with more too. Thank you, Mayor.
Okay, we've got Mayor Pro Tem, Councilor Bate, and then Councilor Bencomo.
Thank you, Mayor. Thank you, Mr. Edison, for your presentation, Chief Smith. Will you go back to the list? I believe it's the capital improvement plan. Yes, that one there. Are you telling, just to clarify, are you telling me that this list factored into the impact fee? Yes?
No, this is not used for calculations. This is used to show what the money is going to be spent on, but as has been noted, the total estimated revenue in 10 years is less than this. It's a little less than $10 million. Although some of these items, longer, I don't remember now, these are within 10 years or some are longer time. Yes, so some of these items are not needed in the first 10 years. They may be needed a little further out. So in that sense, it may not be as much of a shortfall as it seems. But this is just to show, one of the things you have to do in the impact fee program is show what you're going to spend the money on.
Yeah.
Yeah.
No, I'm appreciative of that, and if that's the case, you should probably say that somewhere, that it's not going to be affected during the 10 years, that it probably will be the 11th year, the 12th year, I'm not sure. I'm concerned because some of the things that I know through our GeoBond public meetings, fire had the building 9 is something that you're advocating for, and so is it putting this on this list at this point concerns me. If we're going to go, if the voters will agree, right, that it's going to be part of the GeoBond, this next GeoBond cycle. And then my concern about the fire energy efficiency and sustainability component, I'm assuming, what does that consist of?
Mayor Pro Tem, Fire Chief Jason Smith. So the first item on Station 9 and GeoBonds and funding. So everything that we could possibly spend impact fees needs to be listed in the capital improvement plan, which is why you see it at such a robust number, so that we can actually have the option to pay for it. So for Station 9, kind of a spoiler alert, what we're looking at with our consultants on the cost of it, the impact fees will not cover the whole amount.
No,
What we might be helpful in is sharing some of that cost, where we can pay for the apparatus, pay for maybe some of the capital. This is very similar to what we did with East Mesa Public Safety Building. When we first started, it was through bond cycling, and we had the funds to build the station. We purchased Fire Engine 8 with impact fees. And then as we were going along through construction, some of that construction was actually paid for out of the impact fee balance. And then moving forward, after a little bit of time and we were moved into the station, we moved all of the debt service to the impact fee. So currently, we're on pace for revenues and expenditures in the impact fee to match each other. And our only ongoing expense for the impact fee is the East Mesa Public Safety Building. So that's where we need kind of a dual approach of doing this, of coming up with the funds to actually build the infrastructure. To James's point earlier about building a fire station and how much of that do you contribute to new growth. So if we look at Fire Station 9 and where it's potentially located at Sonoma Ranch and Angler, if we were to put a ladder truck there, that would help with our ISO rating and our ISO points throughout the city, as they would serve as a ladder truck to not only their district, but also Station 5 and Station 6 and part of where Station 8 responds to. So more of the community is actually going to get that benefit of the new resource. So that's where we look at the multiple funding sources for it. But we can look at the CIP list, and we can take direction from council today on what items you would like to see and how we might change that to reflect properly, or in your eyes, what you would feel is appropriate. For the sustainability and efficiency, we talked at length about this last week at the Capital Improvement Advisory Committee. They want us to only have that money dedicated for new growth. So not retrofitting an existing station. I can't go and use this money to put new solar panels at Station 1. But they understand the ongoing cost and escalation of prices, and they say, use this for your new buildings. So if you're going to do a new training building and you need to add sustainability and get LEED points, use that separate line item to fit that bill, not knowing what it's going to cost. So we estimated that the efficiency and sustainability would be for new buildings.
That's hard to say 3 times really fast, right? Thanks, Chief. I appreciate
For the
record. Right. So where does Johnson Controls fit into this? This specific, or do they, as it relates to new buildings and fitting for solar and such? Is that not currently something that gets discussed at these meetings?
Mayor Pro Tem, Johnson Controls specifically has not been discussed. It's more of just, like when we talk about Station 9, we don't talk about Jane's Corporation being hired to do the building. We just talk about the need of sustainability and energy efficiency. And I believe historically, and look for somebody from facilities to address that. But usually we use it for retrofits of existing facilities to low cost.
That's what we've typically used it, right, for retrofitting older buildings. Okay. Is that not something, Mayor, that we would be, or EFO, considering in new buildings? Is using Johnson Control, or is that has always been just for older buildings, retrofitting older buildings?
Mayor Pro Tem, if I may, or if you want, EFO, but basically the reason why Johnson Control installs their new equipment is to bring their costs down so they don't have to pay us. So they're probably assuming on new buildings we're going to be using energy-saving appliances or equipment
Sure.
or Energy Star.
Okay, okay, thank you. And let's see, slide 14. On slide 14, I have a question on that. I noticed the police department tactical vehicles. What do those consist of?
Corvettes and interceptors.
Mayor Pro Tem, the tactical vehicles would include a Rook, a Bearcat, and a Mobile Operations Command Center.
Say that last one.
A Mobile Operations Command Center, a MOC, an emergency vehicle that can take over everything encompassing a critical incident.
Bearcat, what would that consist
A
of?
Bearcat is a big vehicle with armor that allows our officers to work safely as they're trying to de-escalate and negotiate during a critical incident.
Is that necessary? Do we need that? Do we have one currently, and why would we need something like that?
Mayor Pro Tem, we have one currently. It's old, about 20 years old right now, and the armor that comes with it has a life expectancy.
Shelf life, yeah.
It has a life expectancy. So, for example, the glass that we just had to replace the windshield and one of the driver's side windows, and it was about $15,000 just for the glass.
Okay, and how often do you use that, Chief?
We use it quite often. Most critical incidents, it goes with our TAC team, again, to buy time and allow safe cover. We also use it throughout southern New Mexico because we have an MOA with the SWAT team with the state police. So we assist pretty much the southern 14 counties in the state.
Would you say that is used mostly for state police in the region?
Mayor Pro Tem, no, we use it more here locally.
Okay, all right. Thank you, Chief. Appreciate that. Okay, those are all my questions. Thank you.
Councilor Abeta and then Councilor Bencomo.
Thank you, Mayor, and thank you. I know we touched upon this a little bit earlier, but looking at how we kind of changed some of the services by including our MIH program, we're going to have the new CIT program. Does that bear an effect on the type, I guess, cost per service? Because it seems like those items might have a higher cost by implementing those programs, and are we factoring that into these, knowing that they will be happening in the future, and we will probably see some growth with it?
For anything where there's not an existing facility, we're not, the fee doesn't reflect that. Now, when you update the fee the next go around, then it will be included. Remember, this is not the end of the story for 10 years, right? You'll revisit this in a few years and update the fee. And when you do, you can use existing facilities at that point, which would include whatever the services are. But for the current proposed fee, no, it doesn't include those expanded services.
Okay, and so I think along with my colleagues, it seems like we're starting at that deficit, it seems like, and always running on that deficit, which doesn't seem to place these departments in a strong position. And so I think that's kind of my concern with that too. If we're always running behind, it's going to be just harder and harder to catch up. And so that to me is problematic for not just right now, but looking on what the future looks like 5 and 10 years from now. Thanks, Mayor.
Thank you. Councilor Bencomo.
Thank you, and thank you for that, Councilor Abeta, because that was going to be one of my first questions was I feel like we're already in a place that we're trying to catch up. It's clear that Station 9 is needed to protect the ISO rating, and thank you. And so that already feels like a huge deficit. That's a good word. And is this formula going to allow us to catch up, or are we always playing catch up because we, municipal government, because for whatever X factors, but it just feels like we're always playing catch up, even though we understand somewhat how the city will continue to grow.
Right. I think that's a fair characterization. I think in a situation where you're always improving or expanding services in the future, which creates additional costs, we're using a sort of a conservative, in retrospective, if you will, methodology that says, and not retrospective, maybe current-spective, it says what's in place now, and that's an estimate of the future. It's correct that to the extent you expand facilities, you're not accounting for that if you're just looking at what's in the present. But the problem we have is if we actually try to sort of project those additional services, you need to find some way that's legally defensible to say what portion of it you can attribute to new development. And the law about this is fairly conservative and actually is, there is state law for impact fees, but the impact fee themselves are governed by what's called takings law. It's federal law. These programs came about mostly first from a couple of cases called Nolan and Dolan that went to the Supreme Court. That's how it started. And then it came back down to the states of you guys need to find a way to routinize it, to not, to put a program in place that treats everybody the same. Because it used to be the way it would work is if somebody had a project, a city or a county would say, well, that's a nice project. How about you throw in a park? How about you throw in a road? How about you throw, which then led to issues. But the other side of that is if you do this in this sort of routinized, treat everybody the same way, in a conservative way, you lose this sort of, your policy concern I think is valid. I'm afraid I'm sorry I don't have a good solution to offer you.
You don't have the answer to that?
But one answer is to update the fee more frequently, right? That is one thing you can do.
Yeah, absolutely. And it's not just this public safety fee. I feel like every time we talk about parks, when we talk about our utility system, we're just always a little bit, frankly, sometimes a lot of bit behind. And it just feels like to me that something isn't paying their fair share. And I would like us to get to that place. And if this is going to help us get to that place, closer to that place, I'm glad. And if there's other ways, IFO, that we can look at getting closer to that place, I'd be really interested in that, even if it is, I don't know, lobbying state law or whatnot. But it just feels like we're always playing catch to the needs of our communities. And really critical needs. Even a park isn't a privilege. To me, it's a utility, right? It's a need in a community. So I think all of this begs a much bigger question, it feels like, above your pay grade, like you said. My other question is, when do we get to hear, will we get to hear the feedback from stakeholders before this last step?
Mayor, Councilor Bencomo, Fire Chief Jason Smith. So we've had a total of 6 public meetings, including one public hearing this past Saturday, and also a presentation to the Home Builders Association. We had one posed question, the same question you've asked, why do we need impact fees and things like GeoBond, how do they work together? We've had that question. Other than that, we've had a total of 4 citizens attend the meetings. So we've had the meetings all the way across the city at different times in different locations, including one that's virtual, to try to gain that input. We had much more robust input in 2006, 2011, when this was brand new. At the Home Builders Association, there wasn't any issues raised at that time about the maximum justified fee. And the Capital Improvement Advisory Committee, their committee made up of builders and people in the community, they're voted to support it as presented to council. And they did not voice any concerns that we hadn't, or that Wilden had not already folded into the response.
Okay, that's good to hear, Chief. Thank you. And then earlier, you mentioned just really quickly on what you were looking for today, the guidance you're looking for today, and in our packet, it sort of says that you're looking for council to guide the specifics of the fee structure. Can you revisit that? Can you tell us specifically sort of what you're looking from us today?
Well, really, it's a matter of, one could be actually between the 2 alternatives, whether you have a preference. What we did is we used the existing, in terms of the types of development that are charged and the unit sizes, we use the existing fee. If that's acceptable and that's fine, we'll just go with that. And, asking for input doesn't mean there's any real giant decision point here, but it's really a matter of sort of presenting it to you, and you tell us if it still makes sense or if there's something that we need to adjust. We did, with the CIAC, come up with this alternative, which is a little simpler, but is not a huge change. But in terms of guidance, it's really, we don't necessarily have to have any guidance. I mean, we've done the work, we're doing the calculations, we can proceed. But it's a matter of whether you've got anything to tell us or share or guide us. That's really, that's the question we're posing, not that we're expecting guidance exactly.
Okay. Well, I mean, for me right now, I want to do the option that gets us closer to what feels like we're meeting the needs of our community. That's the option I prefer.
Councilor, now, by no means am I advocating for property tax, but let me just share something with you, since we have this schedule up. So I took 1,000 houses. If you use an average valuation of $250,000, our tax rate is 0.0088. So that's $371, well, that we get from the county. I know the county's here, but we get almost 17% of the property tax. And you put that to 1,000 houses, we're going to get $371,000, which you can tell is nothing for 1,000 houses. That's why when you see, and I'm often reminded of years ago when Sunland Park annexed the business part of Santa Teresa, they didn't want the houses because that costs money. They wanted the business because that generates revenue. And so, as you can see, the comparison of an average house of that we get $371, compare that to the fee, it's, I mean, you can only, so you see the difference. So it's, therein lies why I had supported, or I liked the fact that we did a GO bond, because it spread it out. But again, it's up to my colleagues here. I'll go with either way because I know it's important to have that, because when the fire department became such a high ISO rating, to many people, sometimes it saved them $30 to $40 a month in property tax, in insurance. So, which is a lot more than that increase in property tax for a GO bond.
Not to mention lives.
Yeah, well, it's good. Yeah. Okay, who was, yes, Councilor.
Thank you, Mayor. You said very plainly that you really don't need to hear from us, that you know where you're going with this, so why are we here? What do you need from us? I mean, this is money, so that's baffled me. I just said that, and I really didn't have any questions before that, but that's my question. What does that mean?
Mayor, Councilor Flores, Fire Chief Jason Smith, for the record. I've prepared the work session. That is my request, because if you're not in favor of the maximum justified fees, I would definitely like to hear that. Hearing your support for pursuing that helps. If you have feedback of the capital improvement plan, the objects that we may need to evaluate or remove, even thinking about this, your comments made me think that, well, the current existing East Mesa Public Safety Building, since that debt service is there, I need to ask our consultants if we need to add that to the CIP plan for council to approve so that we can continue that debt service. So I do want your feedback. It is important because we need to be able to answer those questions because the voters hold you accountable, and we need to give you the information you need to answer to them.
So we're not voting on it today, so it'll come back to us for a vote. So the fee, the impact fee, as you call it, is one that we're looking at for the possibility of taxpayers to carry that burden, or it could go to a go bond vote. Are those the options? Or am I totally misunderstanding?
I think what the chief was talking about was that one of the permissible uses of impact fees is to pay debt service. So this impact fee revenue, these fees are paid one time at building permit. They usually accumulate in a fund over time to essentially save up for a large.
The fees are collected from whom?
From builders.
The builders.
So when someone goes up for a
So
building permit,
impact fees generally are collected from the builders. So why wouldn't any future increase go to the builders? That's what boggles me, my mind.
I'm sorry, increase in what would go to the builders?
The rise in the impact fee. You're talking about impact fees, you're talking about services. Impact fees go to builders. No?
Well, they're paid by builders.
Yeah.
The builders don't receive the impact fee money.
No, they pay the city.
Yeah, that's correct.
Yeah, I know that. But so what is it we're really talking about here? We're talking about an increase in impact fees.
Yes.
So we have to authorize the city to be sure that they collect that from the builders?
Well, you're the ones with the authority to impose the fee. So you adopt the fee. Once you adopt it, then the city staff will charge it to builders when they come to get their permits.
So why is this different than any other increase in impact fees?
I'm sorry, Council, what was your question again?
Why are we here?
Okay.
The impact fee is collected from builders, so why are you asking us to decide whether it goes, that money, that the increase in the impact fee, that should go to the vote, that it shouldn't go to the builders? I mean, I always thought that impact fees were collected from builders. So why is this different? That's all I'm asking. Why is this different?
Well, I don't believe it is. I mean, what's before you is a recalculation and a refresh, if you will, of the impact fees, which results in an increase.
Yes, I saw that.
And an increase in those impact fees. But in order for that to happen, by New Mexico state law, we have to go through this process, and you have to adopt them by resolution. And once that happens, then staff can charge the fees, and the developers will pay them.
Okay. So okay. And so how would it be worded to our constituents if we were to abide by New Mexico law? How would this, this body would decide how we collect those impact fees?
Well,
What the source, excuse me, the source of the payment of the impact fee?
Well, the source is the people applying for the permits. This fee is limited only to new development. So if someone already lives here, the only people paying, or entities paying in many cases, is corporations, or when they go to pull a permit to build a house or to build a shopping center, they pay a variety of fees at the counter, and one of those fees is this fee.
So we can just say, yes, we'll continue to impose the impact fee on the builder.
Yes, at this higher level.
See, I always thought, I think this is the first time it's come up in my,
We've done it in the past. And Councilor, just to clarify it, the reason why we're here today is I think they showed the current fee really doesn't generate enough to build another fire station. So, okay, so then they went back and they have this newer higher amount, but even that's still falling a little short. And I probably confused my colleagues when I talked about a GeoBond.
yeah.
Now, that goes to the voter, but this one here, we could actually pass here ourselves, and then every time they pull a permit, then that fee, is collected.
But from whom?
From the builder, but then, of course, they pass that on to the consumer.
Okay, so it's really no different than anything else we've done before.
That's
Okay.
correct.
Well, big to do. Thank you. Thank you very much.
Councilor Coran?
I just wanted to say thank you again for coming and sort of hashing this out. And I support always simplifications of things, so I would like to voice my hope that we can use the alternative fee schedule, because it sounds like residential 900 feet or less is not very common. So I support that approach and the maximum justified fee in the context that you.
Can you go back to the slide before Mr. Edison?
The comparison?
The one, there you go. So what we're looking at, if we were to the maximum justified, is additional anywhere from 126 to 344 on the residential. And then anywhere from 97 to 1,701 on non-residential, for the most part. So, and I'm wondering if it's possible to do a hybrid. I mean, if we were to pass this, but then also keep the option open for a GeoBond for the actual structure, and maybe are we allowed to use this for some of the equipment? I think it sends a better message to the public that we're doing this here, and we're trying to do certain parts, and growth is paying a portion of it, but yet at the same time, it's spread out among all the residents in the city. Is that a possibility?
Yes. And there's a variety of equipment that are allowable uses,
Okay.
Especially apparatus.
Okay, yeah. I mean, that way we don't have to wait around for several years, because it'll take a long time for the money to collect to build another fire station. That's why I'm extremely grateful to the residents of District 3 and 4 who and that was able, the whole city paid for that, and District 4 benefited from that new fire station, and that's good, because most of our residents, for the most part, aren't always going to just stay in their one district. Some will, but a lot of times they move, and they move different parts of the city. And so invariably, they could also benefit from it. That's why I think it's a good option to at least keep it open that we might go to a next GeoBond to build another station. And if we have some funds, at least it shows that we're contributing to it. Good. Okay. Any comments from the public? Chief, you have any closing comments?
Thank you, Mayor, members of City Council. As always, thank you for the opportunity to present to you on the topic and for your support for public safety in our city. Thank you.
I will say one thing, and maybe Larry can attest to this, but usually when we're talking increase in impact fees, we usually see a room full of contractors or builders, but I guess we haven't advertised this, but we have. I've seen the advertisements many times, but I will tell you this much. When it comes to public safety, they support this. They know how important this is. I mean, this is, you can't put a price on that. Okay, so it looks like we're okay to move forward. Yeah. All right. Okay, so the next item will be the Donand County Triage Center update. And we have Program Director Karina Diaz and Clinical Director Jess Spohn. And I see City Manager Fernando Macias back there. Now, if the county was to give us all of our money from property tax, then we would, be good.
Oh, hello.
Hi.
Good afternoon. My name is Karina Diaz. I work for RI International, and I'm the Program Director at the Crisis Triage Center.
And I'm Jess Spohn. I'm the Clinical Director at the Crisis Triage Center, and I'm a lot smaller than Karina is. Thank you very much for this opportunity, Mr. Mayor and the City Council. So we are employed by Recovery Innovations International. Our mission is to empower people to recover, succeed in accomplishing their goals, find meaning and purpose in life, and reconnect with themselves and with others. Right? Through RI International, we focus on what's strong, not what's wrong. We're very strengths-based. We use a lot of recovery-oriented practices to make sure that we meet the needs of the community for mental health and substance use. Let's see if the video works. That's all right. We'll skip through the video. So there is a video that you can find on YouTube. It's the RI Way. It's the first episode, and what it does is it really does explain what RI does in terms of the 4 keys, kind of our 4 core principles of the work that we do.
Okay. So I think it's important to delineate the model that we follow. RI International started a contract with Doña Ana County to be able to provide a crisis receiving center in the Doña Ana community. The following people actually contributed to this expertise. We follow the Crisis Now model, which was created by SAMHSA, and this is the best practices toolkit, which in part was also created by RI International leadership, who's still there today. 21st, 2021, have been open for almost a year. I'm going to talk a little bit more about the model, right? So like a physical health crisis, a mental health crisis can be devastating for individuals, families, and communities, as we know. While an individual crisis cannot be fully predicted, we can plan how we structure the services and organize approaches to best meet the needs of those individuals who experience a mental health crisis. So as we know, primarily, the way that mental health crisis has been handled has been through the 911 medical model, right? Receiving a call to the call center 911, then dispatching EMS, fire, police, and ultimately, if unable to stabilize a crisis in the community, then those people are transported to an emergency response center, so emergency department. We are saying, and with this new model, is that we can provide that level of crisis now care through a behavioral health lens, right? So crisis services are for anyone, anywhere, anytime. We say yes to anyone coming into our center. We, of course, have the example of crisis level safety net services seen in communities around the country that include 911, accepting all calls, and dispatching support based on the assessed need of the caller. So similar to that, we will have, which is coming to fruition in July of this year, we will have a 3-digit number, that's 988, that is on a national level. So in part, this crisis receiving center is, in following this model, is the first in line to be a part of this response. Right, so the ideal model, as delineated by SAMHSA, the National Guidelines for Behavioral Health Crisis, is having a call center similar to that to 911, 988, statewide, nationwide, then having a mobile crisis response or services in the community, and finally, a place to go, a crisis receiving facility such as the crisis triage centers.
So we wanted to give you kind of a brief overview on what we do at the CTC, at the Crisis Center. We are open 24/7, 365. The way that I consider our Crisis Center is similar, kind of in line to a mental health emergency room, right? When you go to the emergency room, they don't say, oh, you had a broken arm last week, sorry, you can't come in. And when you go to the emergency room, they don't say, you know what, there's already like 15 people here, sorry, we're full. Right? They will take you anytime, right? Any day, no matter how many times you've been there to that emergency room or to similar emergency rooms. And so we provide similar services for mental health and substance use. All individuals that come through our crisis center are referred to as guests instead of clients, patients, customers, right? Because it gives that more personalized, warm welcome feeling to these individuals that are needing care when they are feeling most vulnerable. We also, right now, with the Crisis Center, have a co-located mobile crisis response team, which connects with 988 initiatives. So the CTC serves adults. We are able to host individuals who are 18 and over, who are experiencing a mental health or substance use crisis, which is identified by that guest. We're not in the business of saying, sorry, your crisis isn't a crisis enough. We're here to say yes to anyone that's requesting services from us that is at least 18 over. And we do take individuals on a voluntary basis, right? So they have to want to receive services, identify that they do need that help, and be able to sign the consent forms for the service providing. Each shift, at the center includes a registered nurse, a licensed mental health provider, and our peer support specialists, as well as our night shifts include behavioral health technicians, level 2, and we have our psychiatric providers available 24/7 via telehealth. And peer support specialists are individuals that are in recovery themselves from mental health and or substance use. They've somebody that has been through their mental health and substance use journey. They have received some kind of treatment and are in recovery for a minimum of 3 years. Our peer supports are either currently certified through OPRI, which is the Office of Peer Recovery and Engagement, or they're in the process of becoming certified. And then myself and Karina are also licensed independent clinicians, and so we are clinically run, right, so that we can provide a psychosocial model to the city for the individuals that are needing help. So one thing that we really do focus on is making sure our staff are adequately trained. And so some of the training and development that we use at the Crisis Center is therapeutic options, which is a nonviolent crisis intervention that's very relationship-based. We follow trauma-informed care practices, suicide-safer care practices. We use our recovery-oriented language. We provide reflective supervision. And as a leadership team as a whole, we definitely try to emphasize and encourage self-care of all of our staff to make sure that the people that are providing this care are also taking care of themselves. And all of these practices are in line with following through with the Crisis Now model. So the CTC provides, so what kind of do you expect when you come into the crisis center, right? So when an individual comes to the crisis center, they are welcomed by a peer support specialist. That's our peer first, peer last model. So a peer will come and welcome them. They'll be present throughout the guest's stay, and they're the last person that sees them before they go. They'll receive a nursing assessment to make sure there's no major medical issues that would preclude them from being able to stay with us for the 24 hours. They'll receive a clinical assessment, which is a biopsychosocial. It's mostly a needs assessment to see where it is that we need to go with these individuals. What is the individual needing? What are they looking for? How can we best help them so that we can do these community referrals? And then they'll also receive a psychiatric assessment by a psychiatrist or psychiatric nurse practitioner, and medication if necessary, and if agreed on, between the guest and the psychiatric provider. We also have 3 meals a day, showers, laundry, art activities, games, friendly, helping individuals that are there to just sit and have a chat. Our staff play Uno with the guests and, get them to open up and to be able to stabilize and de-escalate themselves. We also do comprehensive discharge planning, either back to the community or to a higher level of care as needed.
Right, so the CTC leadership also provides training, outreach, and presentations to the community about our services, self-care, 988, and our connection to the Crisis Now model, and what we're trying to embody every day as we work to helping the needs of the community. So we have a vast kind of network of providers within the community and the county to be able to, because at the core of what we do, right, bringing in folks, welcoming them to our center, being able to provide psychosocial evaluations, psychiatric evaluations, nursing assessment. All of this is an evaluative care and observation to be able to connect them to the next level of care. So we are consistently triaging from the moment the person gets to our center. Although we are open 24 hours, the person does not have to stay there the 24 hours. We are consistently observing, assessing what it is that is needed in order to connect them to the community. So at the heart of what we're doing is providing a warm transfer to ongoing care. We will not provide the treatment ourselves in the center. We're providing an intervention and connecting them to resources in the community, which is why these relationships to us are so important. With that said, thank you. We are also providing in continuous training and to staff, not only to these behavioral health providers, but also one of the things that we're really excited about is having a partnership, for example, with Las Cruces Fire, where their staff are going to come the week of the June 6th. I believe it's 3 days out of the week, 4 tours each day for 1 hour for the 4 times a day, where we're going to present, train on what it is that we're doing in the community, how they can connect to us, to the staff level, the direct practice kind of level. And we'll provide a tour as well of the community, which is we're really excited about. Actually, Mesilla Valley Regional Dispatch is also going to send some of their folks to these trainings as well. How do we access the CTC? Anyone can walk in or could be dropped off. We do not require any referrals, and insurance does not need prior authorization to receive services. We accept all insurances and guests without insurance. There is no out-of-pocket cost to the guest. Guests can arrive as a walk-in, come on their own, or a loved one case manager can bring them, or through the first responder transport, law enforcement, fire, or ambulance. So currently we do have a mobile response team. We're gearing up or aligning to a true mobile crisis unit, which means that we can assess in the community, stabilize in the community, or being able to bring them back to our assessment center. Currently, we have a peer support worker and a clinician or a master's level provider going out into the community, engaging someone either in the emergency department, leaving outside the detention center, or in their home or out in the community. We're able to engage with the individual and bring them back to the center for assessment. We are working towards the design of a mobile crisis team at the CTC that is aligned with SAMHSA, Crisis Now guidelines and recommendations. 2 staff, like I said, are designated to respond. A staff member, either a clinician or behavioral health technician, will be accompanied by one of our certified peer support specialists. Our mobile response team can pick up guests from anywhere in the county, community to bring back for assessment and triage. We have had 246 mobile response utilizations in the last 5 months. So about 888, it goes into effect nationwide July 16th of 2022. Most cell phone carriers already have the number active. 988 is a direct 3-digit line to access trained individuals at the National Suicide Prevention Lifeline call centers that will connect a person to a trained specialist or counselor who can address their immediate needs, help connect individuals to ongoing care, reduce healthcare spending with more cost-effective early intervention, reduce use of law enforcement and other public safety resources, help end stigma, we hope, towards those seeking or accessing mental health care. You can now join in this conversation actually every Wednesday. It's called the 988 Crisis Jam Learning Community, and here's the link, every Wednesday at 10.
So I wanted to present some of our initial data for you all since we've been open almost a year here. So the number of guests that we've served per month, as you can see from the graph, is steadily increasing. I put the May graph numbers in kind of a lighter color because we're still in May, right? And so this number is continuing to evolve, but just to show you kind of the process throughout the month. So in April, we did see over 100 guests at the CTC, and we're reaching right now in May so far an average guest per day of nearly 4. And so as we increase our census, of course, we're decreasing the number of days that we don't have anybody in the center, right? So we're frequently and actively utilizing the center every day. So we have currently through May 19th seen close to 600 guests, and about 72% of the total guests that we've seen has been through January and April. And so as we mentioned earlier, right, we are completing, presentations and outreach and trainings and all kinds of things to actively engage the community and let them know that we're here and we're serving our community for mental health and substance use needs. And so we've had a more recent increase in guests due to these presentations that we've been completing. We also have a high satisfaction rate. So in the last 8 months, we've had an average guest satisfaction rate of 95%. And then, so this is a breakout of the individuals that are referring to the Crisis Triage Center, right? So most guests are coming on their own. They've either heard about us through word of mouth, right? We know that Las Cruces is a very close, connected community, and if you say, hey, I'm looking for somewhere that I need help, and oh, my mom told me this, or my sister is here, or I know somebody that went to the Crisis Center and they had a good experience, right? And so it's a lot of word of mouth. We do have partnerships, as we mentioned earlier, with the emergency departments, with the detention center, with Community of Hope Gospel Rescue Mission, our law enforcement, various outpatient and the ACT teams, the Assertive Community Treatment teams through PEAK and La Clinica, Zia Recovery Center for substance use rehab services, and various other community providers, as well as inpatient facilities. And so our discharge locations, the majority of individuals go to outpatient facilities. Some of them are transferred to higher level of care, to that inpatient level of treatment. We do have some individuals that have medical concerns and therefore are transferred to a medical hospital for services there, or they're discharged home to their family. And our most recent data for our law enforcement engagement is that we've had 93 drop-offs by law enforcement agencies. The majority of them are LCPD. And then we have engaged 335 guests at the detention center at discharge, and we've had, from those 335 guests that we've engaged, we've had 35 individuals come over from the detention center to receive services with us. And we are currently working. Do you want to go? Okay.
It's up to you. We are currently working on, as we started this, I believe this was a pilot that started in October with the detention facility and their medical team, to be able to engage anyone leaving or being discharged or released from the detention center. We are able to then send a peer. They have a direct line to our nurses in each shift. And we are able to then send a peer support worker to be able to engage with the folks leaving the center and being able to let them know about our services so that they could come in and we can connect them to services in the community. One of the things that we're working on is being able to, and we're in the process of having some peer support workers that can be, that have gone through a background check and have had some training to be able to go into the detention facility, since we're seeing in practice that kind of engaging them at the end of their stay at the detention center sometimes doesn't always work. So we want to be able to engage them earlier so that they get to know us, what we do, that we're not just that we're not an extension to the detention center, and that we want to be able to welcome them, to be able to connect them to services. We're also working with Memorial Medical Center's ER to be able to have a certified peer support worker also have a few hours of the week in the emergency room to be able to engage with folks earlier, to be able to be a liaison of sorts with the medical staff in the emergency room so that we can connect to them as well.
Thank you very much. Any questions?
We have Mayor Pro Tem and then Councilor Bencomo. Councilor Bencomo first.
Thank you, Mayor Pro Tem. Thank you both so much. I really appreciate you being here, and thank you to IFO and your staff for making this happen, this presentation. You know, I know Clinical Director Spahn for a really long time, and several months ago we talked about how could the city support them in really getting the word out and really helping our community truly understand what they do and the incredible work that you do at the Triage Center, given that it's so new, given that it's maybe a little bit scary, right? And so I've been working with them to figure out how to get this information out there, and I thought a work session would be a great platform for not only information, but for us to be able to ask questions and engage in a conversation about crisis triage, especially I think right now, crisis triage is clearly data-driven. It's best practices for helping reduce the risk to someone and their families. And as we sort of, hopefully on this tail end of a global pandemic where people have suffered loss, illness, there's grief, there was loss of income, there was all of this trauma, and we're seeing it play out in our community in many different ways. And I feel like, I know actually that the Triage Center is a huge part of that puzzle in helping our community recover from all of that. So I'm so thankful for you being here and for this presentation. So thank you. I do have just a couple questions. And really the biggest one is, how else could we support the Triage Center as the city to be able to get information out to the community? I worked with our PIO to put inserts in our utilities bill with information, but that just seems so small and tiny still. So how else could the city of Las Cruces help you in getting information out to our community?
Well, first of all, thank you for this space, right? Being able to have platforms where we can continue to educating and so that people can understand really what we do, and so that it is not such a scary place. And it is a new concept in behavioral health as well. What we are doing, right, and being a crisis receiving center, what is it that we do, right? Again, a psychosocial center, not necessarily a psychiatric inpatient, right, that people are kind of used to hearing about or even going to. Another way that we can help each other, I think one of the pieces that ideally the center was also kind of during implementation aligned with was to have or to be able to create diversion from the criminal justice system to one that is more adept to the needs of the behavioral health needs, right, of the community. So that's still a bit of a missing piece. We definitely are continue to develop our conversations with Las Cruces Police Department and other law enforcement entities, and we'll continue to do that. We'll continue to train, to just have discussions, and to understand each other. I think and we all know that for the last decades, they've been the first line of defense and connection to the needs, the behavioral needs in the community. So we acknowledge that, and we thank them for that, and at the same time, we want to partner with them. We want to make sure that we are working together so that we can help everyone in the community, and that it is not only law enforcement who is having to do that work, right? So, go ahead.
One of the great things about RI is that across all of the RI facilities in the country, right, RI has been doing this crisis work for over 30 years, and they have these types of centers in 10, 11 states or so. But one of the focal points is that at all of the RI facilities, the goal is to have law enforcement officers in and out in under 5 minutes. Right now, we're sitting at about 3 minutes for our officers that bring individuals to us, right? So they can come and they can, talk with the peer support. We can welcome the guest in, and we can say, just get their badge number and say thank you very much, and they're able to go out back into the community to do public safety much quicker than typically we would see if they brought someone to the ER. Right, because then sometimes they have to sit with the evaluation and wait, and so this way it really increases the efficiency of our law enforcement officers to be able to do the public safety positions, right, and it puts mental health in the hands of individuals that are trained with mental health as well. So I think one other thing additionally, right, is just having that awareness, right, so we wanted to come and present to you all today, to City Council and to the Mayor, to talk about really what we do, make sure that the correct information is there, and so that you all are aware and you can spread to your constituents, right, to the individuals that are looking to you for guidance and support, to say, hey, I know this place that you can go, and it's reputable and it's available, and it's not going to cost you anything, right, out of pocket. Sometimes if someone that doesn't have insurance, maybe due to documentation status or something else, right, they are afraid to go to the ER. They're afraid to go get help because they are afraid of deportation, or they're afraid of being involved in the criminal justice system. They're afraid of inpatient, or they're afraid of a big bill, right? And we're not going to give them that bill, right? We bill through Medicaid, and we have other funding sources, but all of our individuals are there, all of our staff are there to treat the individual as a guest, right, as a person, to make sure that their needs are met, regardless of whatever kind of barriers and challenges that they're seeing in their personal lives.
Thank you so much for that. I really appreciate that answer, and especially those last few comments you made. The rest of my questions really are around, and perhaps these are questions for our city manager or for our chief Dominguez, around our own internal policy regarding the use of the Triage Center. How is PD or even MIH, and hopefully in near future, our CIT Project Light, partnering with you all? Do we have a written policy? Do we have something that is very clearly explicit saying, to the best of our ability in whatever circumstance, we will be partnering with the Triage Center for diversion efforts? You know, in the past, I know Chief Dominguez, your predecessor, had introduced me to LEAD, the Law Enforcement Assisted Diversion. I'm curious if that is still at play. But so that's my question. You know, for the folks up here, how do we have that policy? What is best practice for us in terms of utilizing the Triage Center?
Mayor, Councilor Bencomo, it's not in our policy yet, but it is in our training constantly. I have our subject matter expert, Sergeant Bob McCord, in chambers today, so he can explain a little bit more of how we train and how our officers are utilizing the Crisis Triage Center. We have seen it, our officers using it more and more, and a lot of it has to do with word of mouth and the public just knowing that it's there. Our super users, if you will, don't necessarily want to go in a police car, but now that they know that there is a safe place for them to go when they are escalating, if they are in full crisis, obviously we have to probably take them into protective custody and take them to the hospital, but I'll call Sergeant McCord up and he can provide a little bit more information, if you will.
While he's making his way up, can you go back to the slide earlier? Because I thought you had a pretty interesting number there, at least maybe I misunderstood it. Right there, it looked like it said 86 of 93 come from LCPD?
Yes.
Where do the other 6 come from? I mean, I would think, I'm sorry, go ahead, Sergeant, please.
Mayor, City Council, I'm Sergeant McCord, Las Cruces Police Department's Crisis Intervention Unit. So, refresh me on your question. You're wanting to know how we utilize it?
Yeah, what is, really I wanted to know if there was an explicit policy around how LCPD operates and partners with the Triage Center, so I'm curious to hear from you what that process is.
Sure. I feel like so at this point, the Triage Center is basically a volunteer position for us.
Correct.
They don't fit under state statute of involuntary. So at this point, we, by state statute, if we have somebody that is taken into protective custody, we're required to take them to an ER, which is basically we have to take them to a place where they would not be able to just walk out the door. And that's an issue that comes up with the taking an involuntary to the Crisis Triage Center. Now, this is what we train. I attend several briefings throughout, well, I mean, I can't put a finger on how many briefings I attend, but I attend the briefings through all 3 shifts so that they're aware of exactly how we can utilize them. If I'm not mistaken, I think we used it 3 times yesterday when I was working overtime. And they're exactly right. We're in and out of there in 3 minutes, which is great. The police officers, they love it. Gets them back to the things they like to do. So I've complimented them numerous times on their ability to do that. So hopefully in the near future, whether it's state statute that changes or we're able to take involuntaries, it would be really nice, and I've said this for the 14 years that I've been doing this, that it would be nice to have one singular facility that we can take voluntary or involuntary to. So hopefully we'll see that in the near future.
Thank you, Sergeant McCord. So right now, state statute says that you are required to take people that you deem in protective custody to an emergency room?
It doesn't say emergency room, but the problem that we have is if we take them to an emergency room, when they do their evaluation and they decide that they're going to put a 72-hour hold on them, then they're detained, they're kept there, or they're processed through the courts. And that's our problem with the Crisis Triage Center right now. If somebody were to go in even before or after their evaluation and decide they wanted to leave, they would not be kept or detained. They would be allowed to leave.
Forgive me, Sergeant McCord, I'm unclear about who makes the determination for a 72-hour hold.
Well, that would be the evaluator that does their evaluation
At the hospital, for example?
Yes, ma'am.
Okay, that's interesting. Yeah, I would, let me back up, actually. At what point do you deem someone necessary for protective custody?
Well, there's several factors. My team has a little more experience with crisis intervention, so they're able to look a little bit further into, say, grave passive neglect, how this person could be a danger if the police officer were to leave. Most officers look at being able to take somebody into protective custody as a dangerous level. Are they dangerous to themselves? Are they suicidal? Are they homicidal? But like I said, my team, we're able to look on a little bit further and do a little more evaluating to determine if this person needs to be taken for grave passive neglect, basically meaning their living conditions or their lifestyle presents a danger to themselves or the community. We still train all of that even in our 40 hours of crisis intervention, but it's depending on the officer and the way they feel as far as being able to take somebody into protective custody.
Okay, I'm curious about how we could have a conversation internally around, I would like to see, I understand that your officers are trained 40 hours, and this clinical director was trained for several years on determining those kinds of things, right? Whether folks are suicidal or they're in mental distress. At what point do we allow mental health professionals to make those determinations over the police officer?
You're not getting any argument from me there. Absolutely, we don't go to mental health training outside of the crisis intervention or what we get from experience. So they have to do just counselor the best they can, to make that determination. I think we do a really good job of training. We've been at this for over 14 years. I believe that we're ahead of the curve in other departments as far as training of CIT. I think our department has done what's been necessary to make sure that we're there. I can relate numerous incidences to you that I feel like we've protected the department and the city from liability just by the training that we've done. I'm also a negotiator for the hostage negotiation team. And through my experience, 27 years in police work, I've seen where police officers do a really good job of handling people in crisis. And I'm going to give a prime example. There's a man by the name of Dominic Messina, and he's deceased now, but he was actually the negotiator that got the negotiation team started in New York City. So all my negotiators are trained under his school of thought. And one of the stories he had when they were first getting started is that they had a guy on a roof that was getting ready to jump off the roof. So this new team of negotiators went to speak to him. And basically one of them said, hey, just on the floor below us is a psychiatrist. Why don't we go get him, bring him up here to talk to this guy? So two of the negotiators went down and talked to the psychiatrist, and the psychiatrist says, yeah, I'd be more than happy to help him. Get him down here and put him in my office, and I'll talk to him. And I guess my point in this is, man, we deal with this every day. We deal with de-escalation. I think we've done a good job in our training. Do we go to school to become psychiatrists and sociologists and social workers? No, ma'am, we don't.
Sergeant, is your team the only folks right now in LCPD using the triage center, or are all officers?
No, everybody is.
Okay.
Everybody trains in it. You were asking about the LEAD program.
Yeah.
I'm also in charge of that. There's been some other issues that are outside of the police department that, in my opinion, have made it hard for us to operate in the LEAD program, but I think we're ironing those out. But no, all officers have the ability to use both programs.
Okay, great. And maybe this question is for either of you around this conversation around protective custody, and if you have any additional thoughts on how could this be improved, this process.
Go ahead.
Thank you. I'm going to step in as a partner of the CTC. My name is Jamie Michael. I'm with Donand County Government, Director of the Health and Human Services Department. The issue about protective custody and voluntary versus involuntary is something that Sergeant McCord and I have been talking about for years, probably when I was not director and he was not sergeant. But it is something that we all need to collectively come together and go to Santa Fe and advocate for some changes in legislation. So the regulations that set up the licensing for crisis triage centers use the word voluntary. And in my opinion, it shouldn't be there. It should just say a facility, and then let each facility create their own policies internally to be voluntary or involuntary. On the treatment side, you heard Karina and Jess talk about when a guest walks in, we want to engage them. We want them to willingly be there, and that is the treatment perspective. It's going to be a much better interaction if the person is willing to be there versus there involuntarily. Law enforcement has a different perspective. They see that there's a need and they want to take action, so they take people into protective custody. But some people might need services but still voluntarily go to the triage center. In a lot of the other communities where the facility can accept someone involuntarily, at the moment, so they start off involuntary in the back seat of a law enforcement car. They get to the front door of the crisis triage center, and within a couple minutes, their status goes from involuntary to voluntary. And this happens 80 to 90% of the time because it's a different person, it's a different environment. So it's much easier for the individual to voluntarily agree to stay there. But we do need to change that law because their license doesn't allow them to keep someone there involuntarily. And we don't want to get into trouble with licensing. The other side of that coin is a different state statute that gives clinicians the same authority as law enforcement officers to basically take someone into protective custody if they fear of imminent harm to self or others. So if someone comes in and decides to leave, but it would be very dangerous for them to leave, Jess can do the same thing that a police officer can do, but at that point they can't stay at the triage center because they've become involuntary, and it does say law enforcement at that point transfer to another facility. So that is an area where there's kind of a rub between the two fields. And just additionally, it is written into the lead policy that the triage center is the drop-off place, and I want to just thank the chief. In the next couple weeks, we're going to have some additional lead training to become part of the academy, so officers graduating from the academy will immediately be aware of the triage center and the jail diversion opportunities.
That's great. Thank you so much for that very good answer. I appreciate that, making that very clear. Those are all my questions for now. Thank you, Mayor, and thank you all so much. Oh, I'm sorry. If you do pursue something like that in Santa Fe, please let us know how we can be involved in that. Thank you.
Thank you, Councilor. Mayor Pro Tem.
Thank you, Mayor. Thank you, Jess. Thank you, Karina, for being here today. Great presentation. I appreciate your willingness to come and present to our Health Policy Review Committee. Gosh, that was like a year ago, I think, more than a year ago. We learned a tremendous amount and just afforded us the opportunity to talk, and that was still, we were virtual, if you remember that. And then so you're aware, you may not be. This is a standing agenda item on our Public Safety Select Committee. So we talk, this consists of our fire chief, Chief Dominguez and his DCs, and we speak to sort of the numbers where, because we feel that this is a service and a very needed service, and to free up, law enforcement and fire to do the work that really they've been hired to do. This is an excellent way. So, we're prompting them, how many cases do you get? How many are you referring to them? And I also know that they have sat on your Wednesday meetings with the 911 or 988. I don't know if they're your meetings, but they've had those discussions. So we're really encouraging the coordination and collaboration. If there are issues and concerns, that those courageous conversations are being had very clearly, and some sort of solution or strategy, is being implemented if there are any issues. And really, really, I think any of those, if there are issues, they're being discussed and worked through, and it's more about just building relationship, engaging, trust, right, and making sure that there's that line of communication. So I appreciate you both being very open about, and your willingness to do that. Jess, you sit on our Suicide Prevention Task Force, which I appreciate. And so, my questions are around the dialogue that's occurring in terms of the process, right? And around 911 now going to be 988 as it relates to those people in crisis that typically police are responding to. What sort of dialogue and conversations and process, and really to Councilor Bencomo's point about a policy, I think that really needs to be discussed with MIRVDA and those folks, and how, what sort of dialoguing is happening so that, the appropriate calls are going to the appropriate source, if you will.
You can come. The more the merrier. But I do want to say that we have had engaged in numerous conversations with Mesilla Valley Regional Dispatch. I continue to have a conversation with them every Monday, along with New Mexico Access Crisis Line, that it will be turning into 988. So there's still a lot of things that are kind of, if you want to help us, that are still up in the air.
Keep turning back, and they're just
Yes,
not
I'm
willing
like,
to get up here and
But I do want to say that all of those conversations, there's a lot of things that on the state level that are still kind of being worked through, and we're at the forefront of that conversation.
So I'm interested in the local level, right? Making sure that we're communicating and coordinating and collaborating those, just in collaboration, making sure that those calls are going to the appropriate, responding response, whatever that might be. And I just want to make sure that that's happening. And if it's not, how can we help ensure that that takes place?
So Jamie Michael, County's Health and Human Services Department. I believe it was almost 2 years ago that the city and the county established a Crisis Now work group. So public safety, fire from each agency is invited each month, along with the New Mexico Crisis and Access Line, the Crisis Triage Center, and MIRVDA. So those are the three components represented in the Crisis Now model: the call center, the receiving center, and mobile crisis, and then all of the law enforcement and EMS people that are part of the current 911 system. So we all get together and discuss what's happening at the national, state, and local level, so we can do that local planning. The state is taking care of the call center, so New Mexico Crisis and Access Line is already basically our 988 center, and they have created the connection with the MIRVDA, with 911, so calls that come in that they deem appropriate would be transferred over to 988. 988 call takers, who are clinical behavioral health specialists, will then address that caller, and if needed, dispatch the mobile crisis team that's at the triage center. They go out and do their behavioral health engagement and assessment, and if deemed necessary, bring them back to the triage center. That's how the system is supposed to work, and we know that it takes a while for a new system to come to play, so it's going to be a big mind shift. We're really asking people in law enforcement and 911 to move away from what they've been doing for decades and move into a different system, move into a behavioral health system, which is difficult to get those changes. So they have been doing a lot of training with the 911 dispatchers to make them feel comfortable, because very few calls get transferred to the New Mexico Crisis and Access Line. And we know that each day there's probably a handful that should get transferred and could be addressed in a more appropriate way. So the state is standing up that call center. The state is working with RI to contract for mobile crisis. We've contracted with them for mobile crisis, and we'll keep the triage center. We do need some new policies around how, when law enforcement is on scene with somebody and they're either on the fence about protective custody or they know that this is a protective custody situation, But if it's not a public safety situation, there's not a firearm or a weapon or something, call mobile crisis and have mobile crisis go out, because mobile crisis might be able to engage voluntarily. We want the least restrictive intervention. So if someone is willing to engage in treatment or willing to go somewhere voluntarily, we should. It's going to be much less traumatic to ride in the back of the van with Jess or Karina than it is to ride in the back of the car with Sergeant McCord. As wonderful as Sergeant McCord is, that's not a fun place to be. So if we could get mobile crisis on scene more often, I think that would be very helpful. And then Chief Smith and I are working to figure out how the mobile team that the city is creating, how that's going to work with the mobile team that's part of the 988 system. So how do we not duplicate and fragment the system? What type of calls, what type of response? How do we address that within the 988 system? So those are some things that we're looking at locally. One area, and I know you're probably very concerned that there is not a lot of conversation and not a lot of resources, is mobile crisis teams and crisis receiving centers for youth. So the services that we're talking about are 18 and over. So if a young person needs behavioral health, it's going to be law enforcement and hospitals. So that's an area where I think we all need to focus. And the licensing is very different for each of those populations for good reason.
Thank you, Jamie. I appreciate that. I tuned into the deem appropriate language, quote unquote. Will you explore that in more detail with me? What do you mean by that?
So I'm not.
I think I know what you mean by that, but I'm more, making sure the public is aware of what that means.
It's not as black and white as I would like it to be, but I'm not a clinician, I'm not a law enforcement. It's difficult to put a bucket that's public safety, and to me, that means when there's a weapon or some kind of public safety issue. There's medical. Something's happening with your heart, your circulation, your other organs in your body. Then there's behavioral health. That's more of a behavioral, a brain, a mental illness. So it's hard to put all of the calls into separate buckets because some calls are all three. Yeah. And so it's depending on who's going to take the lead, because it could be all three of those things happening at once. But for the most part, you can look at different circumstances within the call and get information and be able to determine deemed necessary. So suicidal, but there is no means. A crisis triage or a crisis, mobile crisis response is probably better than a law enforcement response. Some substance use, if there is not a medical emergency, the triage center has a nurse there. The triage center has a pharmacy with medication. So for some substance use issues, the triage center might be more appropriate than a hospital. So definitely a lot of the suicide and other behavioral health, when the behavior is just not what the individual is expecting. It's scaring their family, scaring their friends. I think those are the types of calls that can go to a call center. And then that behavioral health expert might be able to do a better job of deeming what's more appropriate to go into which system. It's not a clear list of call types, but we can learn from other communities, and I think there are some low-hanging fruit where we can say these calls should be part of the 988 system.
I appreciate that. I know it's so gray. I get it. So I am thinking about how we provide more information to the public. And do you have flyers and brochures and posters and maybe stickers? And I'm thinking about businesses that you might have a sticker where in crisis, here's the phone number, so that someone can because we're hearing a lot from the business community, right? Especially around our homeless population, a cohort of our homeless population that's in crisis, that's probably co-occurring disorders that are, Jamie mentioned fears, scaring the public, if you will. So I'm just thinking of ways that we can inform the public that you all are available in a number quickly that we can, which will soon be 988, I think, right? Hopefully.
One of the things that we are doing is working with the county to be able to have a logo, being able to have a marketing material so that we can disperse to the community. Ideally, I imagine commercials, 24/7, radio kind of commercials, TV, newspaper in English and in Spanish, to be able to inform the public of the services and educate the public of what it is that we're doing and how they can access us. A lot of the times, and we see this and we foresee how much more, or we will receive a lot of calls, hopefully through the 988 number, but habitually 911 has been utilized, right? So there will be, there needs to be, which to your point, a lot of communication between 911, 988, and for us to develop and trust our relationships so that we can work together to kind of dissect what it is that we need to do and who responds to the community's needs.
So I did bring with us today, I brought some of our flyers. I don't know if I can just come bring them up to you. But, okay.
Christine, our clerk.
They're double-sided English-Spanish to meet a wider need of our community. We also do community outreach and presentations, right? So we talk with councils and local businesses. Our peers take flyers out to local businesses. We've gone to some of the gas stations and a lot of other locations for them to either put up the information or just have it at hand, or so that they know that if they have someone that's coming in crisis, that they can call us and we can use our mobile team to come out to bring that individual into the crisis center.
Thank you, appreciate that. And then lastly, I'm interested in your recidivism rate. I didn't see it. People who are coming back to the triage center, and might you have those numbers?
We do not have that data at this moment. We do, up to right now, we have 560 some individuals served since we started. We do not have that data of the people who are coming back to the center.
Okay. And I guess I'm interested in that data and sort of the source, why, right? I'm interested in how we coordinate right through our local behavioral health collaborative and some of their game-changing strategies. Really glad that you're speaking and working with MMC and sort of that discharge planning, the discharge planning that's occurring really from the detention center, or people that are coming out of our acute facilities, right, to no home. I mean, all that work that's being done, and then they're just back into with no house, right? Some of the very basic things, I think those are really important to hear back. And I think there's some very valuable and critical information as a council that I'd love to see from you all, so that we understand, I think, where, we might plug in funding and, maybe a different program, if you will.
So that's wonderful. That's wonderful to hear, and we will definitely work to make sure that we have that data. I think also just from a behavioral health lens, even the folks that are coming in multiple times, we actually see that as a positive, which is, I know it's kind of daunting to hear, but we see that as a positive because this person is engaging continuously with our services. We know in behavioral health and substance use that a person will come through our doors multiple times before they're able to hear or are ready to engage in services.
Sure.
So we're at an advantage point, right? Being that welcoming place where we don't turn them away and could, maybe on day 10, know or understand something that they weren't able to hear on day 1, and we didn't turn them away, right? So the higher the chances, because we know in behavioral health that it can take a lifetime for a person to modifies behaviors. We are at an advantage point that we're not turning anyone away. So even if that person is here on their 30th time, and that 30th time they're able to, something clicks for them, and they're able to move towards this more ongoing kind of recovery of care, then that to us is gold.
Right. No, I appreciate you saying that, and I didn't mean it, or if it sounded as a criticism, that's not what it was more around ensuring that we understand, social determinants of health, ensuring that our folks' basic needs are being met, and if they're not, and clearly, I'm hoping the public is listening to this, and they're getting a lot out of the fact that you're around, that the city's doing what they can to support you, and encouraging really our police department to work more closely with you, and that idea that come July that 988 is available and the Crisis Triage Center is available there for folks' mental health needs, right? And it could be that co-occurring disorder, right? The people falling off, that they need to get back on. Maybe it's that 100th time, and it's going to be the more positive time, right, where they're more inclined to engage in the services. For me, it's more about hearing what are those needs that are not being met that the city needs to be aware of.
I have a suggestion for that. Jamie Michael, again, County Health and Human Services Department. I know that they don't have the data here in numbers to show you, but based on my conversations with them about their most familiar faces, it is people who are experiencing homelessness. And what I see with our LEAD program, with the Crisis Triage Center, with some of our other programs, people don't have a quick, easy place to live that is not a motel next to the same people where they get substances from every other day of the week. So I think our community needs a nice location that is away from some of these negative environments. So putting somebody in a motel, again, that's going to put them back in the same environment is not going to help them make change. We need a new way to address temporary emergency housing for all people. Substance use, no substance use, families, psychosis, no psychosis. So we need a really no wrong door, I guess we would call it, temporary emergency housing. So if somebody needs to stay there for a couple of weeks before moving into, which I know we have a lack of permanent supportive housing, but right now a lot of people come to the Triage Center because they have no other place to go. And I do know that one of the folks who comes fairly frequently to the Triage Center was there a few weeks ago, was intoxicated, knew that they were not doing well. They showed up at the Triage Center. They immediately began having an opioid overdose crisis, and they were able to save their life. And that's huge. This person, if the Triage Center hadn't been there, if it hadn't been a nice place for them to go, they wouldn't have gone back. And that night, there would have been another opioid fatality in our community.
Yeah.
So wanted to share that story and just say temporary emergency housing that is supportive and clean and a nice environment for people.
Thank you. Thank you, Jamie. I appreciate that. And then lastly, Ifo, I was hoping that we could not only do press releases, but I know that in the past, Mandy and before Mandy, they would do interviews, right, for the CLC TV. And maybe, I don't know if that has happened yet. I don't recall it. I don't remember seeing it, but maybe something like that, regularly having an interview with both Karina and Jess to, just interview them, and so that folks can understand what the Crisis Triage Center is about. And then we used to have a COVID website, but a website that had like our mental health screening tools and phone numbers. I think this would be a good place to add, the Triage Center and a number and that interview so folks can know. I don't know where it needs to reside, and I haven't been sort of perusing through our website, but those things need to be visible for our public so that they just see it and can click on it and seek the help. Those are all my questions, Mayor. Thank you.
Thank you, Mayor Pro Tem. Yes, ma'am, I'll get with my communication staff, and Mayor leaned over a while ago and asked me about our capability and what resources we have to offer, and those are some of the things that came to mind, commercials with our CLC TV and communication. So I'll get with our communications team.
Okay, we have a couple questions from Councilor Zabeta and Councilor Coran, and then Councilor Flores.
Thank you, Mayor. Thank you, Karina, and thank you, Jess, for the presentation and for all the work that you do for our community members. I think you can see not only is this such a needed service and vital for so many people, but I think pretty much most of myself, and I know a lot of my colleagues, share the enthusiasm for this type of programming and addressing people's needs. And I think the numbers also show that we are working within our LCPD, communications. We have it as a standing item in another public safety select committee. So we're trying to have those actions match the words that we say. So we're working together. But as we are building up this type of support and really trying to train people to utilize these programs, of course, we have to think of how long are they going to stay. And my questions probably are more directed towards county officials for the next part, but that is just, there's been some concerns about reimbursement rates. Private insurance doesn't cover some of the cost of crisis care. And so how are we looking to have kind of solvency with all this?
Jamie Michael, County's Health and Human Services Department. Right now, Medicaid is the only reimburser of crisis care. So I believe in New Mexico, we should be advocating our Office of Insurance to make it required for private insurance to cover crisis care. I have a full-time job with Donand County government. I have Blue Cross Blue Shield. If I go to the triage center, the county's indigent program is going to cover the cost of my visit because Blue Cross won't. If I go to the emergency department, which is probably going to be 4 or 5 times more expensive, Blue Cross will cover that. So it only benefits the insurance companies to cover the triage center, but right now private insurance does not cover triage centers, primarily because they're new. We didn't even have a license for a triage center 4 years ago in New Mexico. So it's going to take a while for the insurance companies to catch up, but if we don't push them, I think it will take too long. So we need private insurance to cover. The county's indigent program will cover uninsured, and we consider people who have insurance, but their insurance doesn't cover that type of service uninsured. So the county's indigent program will continue to cover it. If you look at, where's the days? Sorry. So daily average number of guests. The reason that's important is because that can indicate when there is enough Medicaid billing to break even. So the county's investment right now is up here, Medicaid billing is here. The more people that come into the facility and have Medicaid, then we can change that, because we can't keep a high a high kind of grant program covering all the operating costs. We need Medicaid, and we pay a lot of money into Medicaid, so it should be covering that. So we need about 6 people a day to have that break even point, and we know right now that every day there's probably that number showing up at the hospital emergency department that don't need to be there. So not only is it the wrong place for the patient, but it's not contributing to the sustainability of the triage center. But right now, our county manager and county commission is committed to using the indigent funds, the health fund, and some of our ARPA money to support and make sure that this is successful. It's an investment that we knew was going to take some time, but knew that it would be worth it for our community.
Thank you. The second question will probably go to you as well. Thank you. And it is kind of some of the possible expansions of licensure to help aid in some of those areas that we lack within our community, if you want to expand upon that.
Well, the mobile services are the first expansion that we're working on right now. They're providing mobile services, but we need the state to come up with the regulations, so the state will also reimburse the mobile services. Again, it's never going to be 100% coverage of the operation, but there will be reimbursement for that expansion into mobile. And one reason I think that's a great expansion for the triage center is because you can have shared staff. We don't have a lot of extra clinicians, especially extra bilingual clinicians in our community, to set up multiple organizations doing different service lines. So if we can combine them, we have some shared workforce in that area. So the mobile is the first expansion. The other expansion for the future, New Mexico's license around Triage Center has two categories, 23-hour stay and a license for a 14-day stay. So we are asking the state if we can dual license this facility and have one wing dedicated to the 14-day stay. And that would change things because you're going to then be residential, so you need beds, you need on-site food for breakfast, lunch, and dinner, and you need that type of care. But for folks who aren't sick enough to get admitted into a hospital, but not quite healthy enough to be in the community, or don't have a place to be in you're not going to get well sleeping at the park or under a bridge. So a 14-day observation unit can serve our community. The state is also looking at how do these facilities become regional. They would like every person in New Mexico to be within 90 minutes of a receiving center. If you're going to come from another county, if you're here for 6 hours, it may not be worth the drive, but if we have the ability to do a week or 2 weeks observation, it might be worth the drive. So that observation unit is the second expansion.
Thank you. And I know that observation unit is such a need for our community, and we have a lot for that. With one of the items, Karina, that you spoke about, that our firefighters are going to be doing specific trainings this last week, I was also curious, is that the same type of trainings that our police department has got? You said that, or have they done the same type of training?
So we've done presentations for Las Cruces Police Department. What we, in conversation with one of their lieutenants, is trying to figure out a way that would make the most sense for their staff to be able to receive the information, to integrate the information, and to really understand what it is that we do on a kind of direct level manner. So then we came up with developing kind of like a credit ongoing education for no more than 1 hour, to be able to have kind of like a presentation at the same time that we have a tour of the facility, and that all their staff, and that we record these so that they're integrated into their continuous education kind of learning community, so that it is ongoing. And even if they have newer staff, they're able to receive that information. So we're working so that that is something that we do for all first responders.
Okay, thank you. And then that is the same training that the firefighters are getting as well?
Yeah.
Okay, thank you. And thank you, Mayor.
Councilor Corral?
Right now, that training is for fire only. We will be continuing to do that with the police department.
Okay, but they haven't had that training before then?
They've had presentations, so similar, but not this training specifically.
Okay. Yeah, I highly encourage that, and I think that would be great for them, since you said that they were the first interaction, that it would make sense that they had that training as well.
Councilor Coran?
Thank you. I just have one sort of quick genre of question. Thank you both for being here so much. I'm really excited to see you. And Jamie for weighing in too. My question is really related to sort of, I appreciate what my colleagues have brought up related to sort of thinking about how we can divert folks who are interfacing with law enforcement in crisis. But I'm curious what other in particular for people who have substance use disorders, I'm curious, I think there are a lot of great harm reduction sort of activities in our community, I think related to Narcan and now fentanyl test strips. And I'm curious, I think that there's a really great opportunity for us to go even further upstream in sort of creating a community where folks can say, my friend recommending their friend, not by calling 911, but at a place even before that. And so I'm curious if you all have had the opportunity to do outreach to the populations of folks who might be doing harm reduction, and then secondarily, if you find that the referral opportunities are enough in our community to support those folks who might want to come in at a time prior to an immediate kind of law enforcing interface moment.
Thank you. So we do work very closely with some of the MAT providers, the medication assisted treatment in town. So we work very closely with Amador Recovery Project through Community of Hope, Southwest Pathways, and Ideal Options to make sure that our guests that are using substances have various options, right? So we actually have the peer support worker from Amador Recovery. We'll give them a call and say, hey, we have somebody that might be interested in services, and he comes over, so that we also have that warm handoff, right? Because we know that an individual that sees this person and says, hi, like, I'm going to be working with you, and then they're much more likely to be engaged and return into and actually follow through with those referrals and the services. So they come over and they start the process with us as well. And then we also work with Zia Recovery Center in town for individuals that maybe need a longer stay for substance use rehab. They can begin the assessment kind of intake pre-screening process with us. And give them a call on the phone, work with the peer support, and continue that process. And each agency also refers to us. So if they have somebody that they are seeing that maybe needs the crisis services, they'll refer back to us as well. We also refer to other inpatient places across the state, because we all know that substance use prevention, treatment services are in high demand, and so there's not always a bed readily available. And so we're able to work with the guest, especially those that have Medicaid and may have a safe ride transportation capability available, to get them to Farmington, to Carlsbad, to Albuquerque for inpatient substance use treatment as well. I don't know if I answered both parts of your question.
It did.
So, okay,
Thank you so
great.
much.
Councilor Flores?
Thank you, Mayor. Thank you for your presentation. So what are your, what's your training? Because you're the ones who receive people at the center, right? Or is it just the two of you, or is it's open 24/7, right? So how do you assess someone coming in?
Let me get back.
That's okay, so I can start. Go ahead. So we have an RN, a registered nurse, in every single one of the shifts. We have 4 shifts.
Okay.
We have 1 RN per shift. We have a licensed clinical behavioral health provider. I'm a licensed art therapist. Jess is a licensed clinical social worker. We have other licensed staff.
Yeah,
There's
is this 24-hour staffing?
24 hours.
Okay, thank
Yes.
you. Okay, so say, for example, Officer McCord drops someone off because it meets his criteria. How do you assess that that person is not suicidal or homicidal? And then what do you do then?
We start assessing from the very beginning. As soon as someone walks in through our doors,
Yes,
they're
okay.
met with a
How do you
registered
assess
nurse.
someone?
So we have a CSSRS. We're part of the Zero Suicide Initiative, so Safer Care Practices. So as soon as that person comes in, we have what is called the Columbia Suicide Severity Rating Scale Assessment, which is assessed by the nurse at first entrance. And if that person is showing signs of suicidality, then we create a safety plan, and we observe the behavior and continuously engage through continuous assessment, including the psychosocial, where we ask the same questions. This is a national.
How long is that person there? Is it a 24-hour maximum stay, or?
Yes, it's a 24-hour maximum.
So what do you do with someone within 24 hours to accurately assess that person and to therefore provide the services that person needs?
Yes, we provide the psychosocial assessment, the psychiatric evaluation, and specific assessment for suicide risk, plus observation and engagement.
What happens if that person is suicidal and/or homicidal?
Yes, we engage with them to decrease the crisis. We have ongoing activities where we're talking to them. We have therapists on staff, peer support workers that have lived through some of the stuff that they've lived through to be able to engage them and decrease.
What happens after the 24 hours? Where does that person go?
Yes, so we have relationships with the providers in the community to be able to connect them to services, ongoing care.
Okay, how many people have you had there since you opened? You put some numbers up there, so my question really should be, you indicated earlier that some of the people who go back are repeat visitors, and so those do you count that as a new person coming through the door, or is, or every time you have someone show up at the door, it counts as a new number? Is that correct? So some of these people may be the same people coming back over and over again. So how do you assess whether your services are really working?
So with the individuals that are friendly faces, the ones that are returning.
What did you call them? Friendly?
Friendly faces.
Okay.
I personally don't like the term like frequent flyer, revolving door, things like that. So we use friendly faces because it's more engaging, more recovery oriented, more strengths based for the individual. So for our individuals that are friendly faces, each time they return, we reevaluate, right? So we're not going to provide the same types of services, the same referrals every single time they come. Some of them may be similar because, if it's someone that's coming for substance use, let's use, for example, we're going to continue to involve them and, encourage them to go to see Amador Recovery to, get some type of service to help with their substance use while they're in the community. But if they come in and they say, you know what, I tried to go here and it didn't work, then we'll come with the guest, and all of our services that we provide are very collaborative.
Okay, so yeah, I get it. So how many people have come back, do you know? Just offhand, have you had 5, 10, 15, 20, 30, all of them? I mean, I want to know how successful or how effective your program is. And also, I think the numbers you have, number of guests, that's a euphemism, server per month. It looks like the most you've had was 102 back in April. And how many, do you have any follow-up on these people? Are they homeless? Are they people whose doors you can knock on? Or do you partner with other services in the community to see how they're doing? I mean, I just want to know whether someone just shows up and then it's all very nice to have a guest in your home, but I just want to know exactly whether there has been any success stories, as in effective treatment.
We do, by practice, we do have a 72-hour follow-up with each guest. And so what we do is within 72 hours of the guest leaving our facility, we give them a call. We try to, we give them a call with the phone number that's provided to check in with them. Hey, how are you doing? Did you make it to that appointment? And then if we don't have a direct phone number for that individual, maybe they don't have a phone number, but they're connected to an ACT team, then we have a release of information on file that we can call the ACT team and say, hey, how is this person doing? We want to check in and make sure that, everything's going okay, so that we can continue to make sure that this individual is receiving the services that they need in the community.
So how long does it take you to assess whether someone is suicidal, homicidal, and definitely should be under psychiatric care?
Right, so right from the very beginning, we do the Columbia Suicide Scale. So that's a evidence-based practice that determines if someone is experiencing suicidal thoughts or not. And then while that person is with us, so let's say the person is either expressing themselves that, hey, I don't feel like I want to live anymore, and or on this screening tool, they respond that they are suicidal, then we begin to do our triage process, which can include inpatient stay. So we can transfer to higher level of care for individuals that do need longer, because sometimes when you're feeling suicidal, sometimes you just need someone to talk to, and maybe there's some environmental factors going on at home, and we can address those, in a psychosocial way in our facility, but that's not the true case every single time. And so with some of those individuals that do need longer than we can provide within the 24 hours, we're able to refer to higher level care, and we work very closely with Mesilla Valley Hospital, with Peak, and we also work with...
Okay, so do you have your nurses but not doctors on staff, right? You don't have medical doctors on staff, or do you?
We have a psychiatrist who's an MD who's available on telehealth 24/7 to our nurses.
But not present?
Not currently on site.
Okay, and so you've had 246 calls in the last 5 months, and those calls are based on just calls, people just calling, and you just keep track of the number of calls that you get? Or what's the significance of keeping the calls?
I believe the 246 is the number of mobile responses that we've engaged in, right? So we've had, 584 guests that we have seen in our center, and then there's been that 200 and so times that we've used our, team to be able to go out into the community to bring somebody into the center to engage with them.
Yeah, well, I would like to say that I'm glad that Councilor Beta said that we're working together. And there are just so many concerns I have. One is the cost that's being incurred. I don't know how much the county is paying. I don't know, because when I look at numbers, and some of these are repeat people coming back, as 102 persons walking through the door in the month of April, which is the highest number you've had as little as 2. And it looks like maybe the average is, well, just looking at the graph, I'd say maybe 30 people, 25 people walking through the door. And I'm just trying to figure out whether the cost assessment has been taken into account by the county manager or the commissioners, and just to assess whether there's something maybe more effective for people in need of intervention. So, okay. Those are all my comments and concerns. Thank you very much. Thank you, Mayor.
Councilor, and Jamie was going to come up here, but I don't think the county pays for this. I thought they billed Medicaid for this. But I did have a question, so you can answer that one. And then the second one is, and I don't know if you can expand on, it seems like the city PD is using it more than the county sheriff's department. I don't know, but it just maybe that's where the other hundreds of people go. But if you can expand on that, and I should know this answer, but so let's say a deputy picks up a county resident, takes him to the detention center. Do they have to pay? Does the county have to? I know it's an enterprise fund, or it used to be, but they don't. Do they charge themselves? No.
So, Jamie Michael, County Health and Human Services Department. If someone has Medicaid, Medicaid will reimburse for the service. Any other guest visit is covered by kind of like a supplement that the county provides to operate the facility. It's a brand new operation, so we were never expecting the first day they opened to be at full capacity. We were expecting it to take some time to get to full capacity, and knowing that during that time our financial investment would be greater, because Medicaid only pays when that Medicaid-funded individual walks through the door. They also work to enroll people. So they do work to enroll people in Medicaid, but that's never gonna be 100%, and that's never gonna be enough to cover all of the operations, just like the ambulance. The ambulance gets reimbursed when they go on a call, but nobody reimburses them when they're sitting, waiting for a call. We have the place staffed 24/7, and there may be a person there there may not be. So we need to pay to have it open all the time. And obviously, we want the numbers to be as high as possible, but there's not a magic number. We're not looking at our investment is only good if we serve 500 people. We're looking at, in our community, this number of people experience a behavioral health crisis, and we want that number of people to be able to go to the triage center. And whether that number is 200 or 500, we want to be able to meet the needs of everyone who needs this type of care.
So are you keeping stats on that, Ms. Michael?
Yes, so we know that there are still people every day going to the emergency department that don't need to be at the emergency department, need to be at the triage center. So we're trying to figure out how do we shift utilization from that medical facility to this medical facility.
So you are tracking people who walk through your door? Tracking, when I'm talking about statistical follow-up, do you track people as to your services, the effectiveness of your services?
The effectiveness of the services can be measured in a variety of ways. So if there's something particular that you're looking for, we can look at that. This is an intervention, a brief crisis intervention. So we're not looking for people to leave there having reached recovery or having be all better when they leave. What we're looking for is for those 23 hours or 2 hours.
I understand that part. That's why I was asking the question whether there's any kind of follow-up to see whether there's an effective transfer of services to a facility that is able to meet the needs, but it looks like you don't do that. So
well, the
thank you.
72-hour, they make a call. They try to contact the person or the person's provider 72 hours after they leave the facility, and they document how many of those individuals did connect with their next level of care. So there is that piece that they currently do here with their guests that come to the facility. There's also more business-like analysis that is done, and you can plug in your numbers and look at how much money, if you want to look just at money, having a triage center can save a community, because we know how much a hospital bed costs. We can estimate how much a law enforcement response costs or an EMS response, and we know how much it is to operate a triage center or a mobile crisis team. And you can plug in your numbers and look at the cost effectiveness. But that's not going to happen in the first year or two. That's not going to, you're not going to have that, I guess, your dividends is not going to start paying back until we are at full capacity. And that's going to take a while because it's a new system, and we're changing the system, we're changing where people are used to going. So we need everybody to get behind it and help us make those changes.
Okay, and when did you open the doors there?
June 21st, 2021.
Okay. So you will be having some stats, hopefully, within the end of the year. Thank you very much. Thank you, Mr. Mayor.
I thought you were done like 5 minutes ago. So let me follow up on some questions. Okay, so can you expand a little bit on the sheriff's department? I don't know if the sheriff was here to speak about that, but then she left. But I mean, what is the participation rate? I mean, it's right near the detention center, near the sheriff's department. I would think that it's being utilized a fair amount.
Sorry, Jamie Michael, County's Health and Human Services. We are working with the sheriff and the sheriff's department. They are looking for some additional guidance and framework and agreements before they will begin using the facilities. So we have been meeting with their designated person, like Karina said, to build that trust, to build those relationships, and inform each other about the services. So at this point, the Sheriff's Department is not using the Crisis Triage Center. That's why most of the numbers are your agency. And obviously, Sergeant McCord has been a great champion and has been working to see this facility open for years. So I think that's one of the reasons why there's more utilization from the PD. There's been some nice success stories with New Mexico State University, Messia Marshall's office, and other agencies, but they're much smaller than your police department.
Sure, of course. And in a small way, it saves county taxpayers, and then it helps us utilize state monies as well. And so, well, we hope to see a higher utilization rate. Okay, so I think Councilor Bencomo has a question or comment?
No, I just wanted to comment. I thought we were getting close to wrap up, Mayor, and I just wanted to note a couple things, that the bill insert with information about the Triage Center in Spanish and English will be in June in the utility bill, so I'm hoping that gets to a lot of people, a lot of people's eyes and maybe on their fridge or something. And then, you know, I really do hope, I'm excited to hear what kind of conversations come out with Chief Smith about Project Light, and I'm certain there is enough room in this community for 2 mobile units that are helping people in crisis and distress. So I just really wanted to say thank you, Mayor, for staff at City for making this happen, and for all of you, not just for coming today, but for what you do, and it's hard work, and I just wanted to extend my sincerest gratitude.
Thank you.
Thank you. And with that, before we leave, I just want to take a moment to recognize Sergeant McCord. I thought I heard you earlier say that you have 27 years. It's very rare. I'm sure there are some, but rare to have someone who stays. You could have retired 7 years ago. And for you to continue to stay on, and you obviously love what you're doing, you're a true asset to the city as well as the department. And I just wanted to thank you for your service.
Mayor, before you start thanking me, sir, I only have 16 years here, 11 years in Michigan.
Okay. Okay. So for the record, he said 16 years here and 11 years in Michigan. Okay. Well, we were going to give you a standing round of applause, but. All right. All right. Well, thank you nonetheless, thank you for your service to both communities. Okay. That ends the presentation. Thank you very much and continued success. Thank you. Okay. So next is going to be the Office of Emergency presentation. Stephen Lopez, Emergency Manager and former Chief of Police at New Mexico State. Probably not used to sitting in a suit for so many hours, not moving.
Good afternoon, Mayor and Council. Deputy Chief Justin Allen with Las Cruces Fire Department. Bringing Stephen Lopez, he's the Emergency Manager for the Office of Emergency Management. He's joined today with Amanda Bowen, who is the Deputy Emergency Manager. We've had several opportunities over the past few years to work directly with OEM on different events that have arisen in our community, so this is their opportunity to provide an annual update to City Council.
Thank you for the introduction, DC. Mayor Miyagashima, members of the City Council, and senior city leadership, thank you very much for providing us with this opportunity. My name is Stephen Lopez, and was mentioned, I am the Emergency Manager for the Joint Office of Emergency Management. Just some brief history for those of you who haven't been around with the city since 1965. The city of Las Cruces started the Civil Defense Program in 1965. And shortly thereafter, in 1967, Donand County started a similar program. And obviously that was a very different time. We were in the middle of a Cold War, and the fear was very focused on a particular nation-state actor that apparently is back in the news again. Out of that, in 2001, the City Council and the County Commission joined together to say we want to combine both of our efforts into one Office of Emergency Management. So it was out of that that our current operation really became what it is developing into today. The Office of Emergency Management has a number of areas of responsibility. Some people think of us as public safety and first responders, but in reality, we are the rest of the responders. The first responders is what you get when you dial 911, and that is typically going to be our fire department, our police department, our ambulance service. But when they are taking care of things and it's either a certain scale or it's a certain scale and goes beyond what they are responsible for, that is often where the Office of Emergency Management comes in. Our primary roles are to plan and prepare, and that includes the development of an all hazards emergency operations plan that covers all of the main entities within Donand County, which is our area of responsibility. And when I say all of the main entities, that includes public schools, that includes universities, that includes villages and towns, and of course the municipality of Las Cruces, as well as Donand County itself. We also put together what is called the THIRA, the Threats and Hazards Identification and Risk Analysis. That is kind of the main guiding document that says these are the main things that might happen here. Now, there are other things that are not included in the THIRA that could happen, but are of either lesser significance to where they are already being handled by our first responders on a daily basis, and we don't need to focus a lot of effort on it because they've already got that covered, or they are of such rare possibility, like an asteroid strike, that we don't want to waste government resources on trying to plan for something like that. We also engage with all of our partner entities in conducting drills and exercises, conducting training, and in really resource building. And the resource building is an area, we'll talk a little bit more here in a minute, but something that we're really trying to focus a lot more on, because if we have enough resources, we can really handle the majority of disasters without having to wait for state or FEMA assets to come in. And in emergency management, we like to say, disaster response starts and ends locally. It starts with what we do here for our communities, and ultimately at the end of the day, those other assets that come in are going to leave, and we are what's left here to help out on an ongoing basis. In addition to planning and preparing, we also look at mitigation. Mitigation is what can we do to lessen the impact of a potential disaster? And with that, we actively seek out grants. We'll talk about a few of those here in a minute, as well as engage in activities that are directly focused on mitigation. We also look at response. Now, some of that is incident management that the fire departments and police departments really are not tasked with. So, for example, a pandemic might occur, and that's really not the responsibility of our police and fire departments and ambulance services to engage in on a daily basis. They have other things that our communities need them to do. So in some of those cases, we will engage in incident management. We'll almost always be in a coordinating role because it's not really just the Office of Emergency Management. It may be the Department of Health that we're engaging with. It may be our first responders. It may be senior leadership within the city and the county. And it may be our hospitals and community partners, our VOAD partners, such as American Red Cross and Salvation Army and United Way. So we serve kind of that central coordination role. One of the key things that we are really focusing on, we did a little bit before, but really the pandemic showed us the need, is common situational awareness. Gathering information and sharing it with our key stakeholders so that people who need to make decisions have the information they need to help guide that decision making in a thoughtful and evidence-based manner. We also look at resource management and logistics management. How do we get the things that the people out there doing stuff in the field need? And how do we track people, resources, needs, and connect them all together? And the last phase used to be a separate and distinct phase, recovery. We used to say recovery started when response ended. Now we like to point out that really good recovery starts before we have a response. We actually start putting together our community lifeline partners. We don't want to wait to first communicate with, for example, El Paso Electric until after a disaster has occurred and they've lost all of their assets in a particular area. We need to really start that effort much earlier on. And as a result, we now, when we start a response to a large disaster, we also start the recovery side of that, because there are people in need right then during the disaster, and we need to start connecting those resources for that long-term recovery as quickly as possible. That may be through the State Disaster Assistance Program. That may be individual assistance through our VOAD partners. And I apologize for using the acronym. VOAD is the Volunteer Organizations Active in Disaster. And that's a program that locally we just got started here in January of this year, and we've had really good participation from the American Red Cross, the United Way, the Community Foundation of Southern New Mexico, and a number of church groups. We get regular participation from our partners down in the Amador Health Center and through the Community of Hope. And really it is paying dividends in being able to bring those people together so there's not duplication of services, and there's a very rapid ability to reach out and help people. And then, of course, there's the federal disaster assistance if and when the federal government agrees that there is a disaster and that they are going to help us out. And you would think that is a lot more automatic than it actually is. Even the State Disaster Assistance Program, we have yet to receive a dime from the state for the flooding disasters that took place in August of last year. And it is our understanding that that is very normal, that they take a while because they want to make sure everything else that's possible has been paid for by insurance or whatever else before they will give us any funding. On funding, the Office of Emergency Management is funded from the Emergency Management grant, the EMPG, for 50% of our personnel costs for the emergency management professionals. That's my position, that is Amanda Bowen's position, and that is our emergency coordinator position. Those are the three positions in the office as of today. The city and county then split the other half of those personnel costs, 25% to the city, 25% to the county. Plus we have an administrative assistant that the EMPG program will not cover, so that is split 50-50 between the city and the county. The city and the county also currently split, per the Joint Powers Agreement, 50% of the operational costs. Starting July 1, assuming the state approves our revised EMPG grant application, we're going to be adding a fourth position, another emergency coordinator, and the city of Sunland Park is going to pick up what the city of Las Cruces currently picks up for our other three positions. So they'll be picking up 25% of the personnel costs, that's salary and benefits for that position. Donand County will pick up 25%, and then the state will pick up the 50%. That's going to allow us to really start looking at what is a rapidly growing area in our region of operation that really does have impacts directly all the way up here into Las Cruces and even into Hatch, because they have a lot of very, very big things going on down there that they are planning over the next few years. A brief look at statutes. State statute is what gives the local governing bodies, the political subdivisions of the state, the responsibility for all hazards emergency management within each of their jurisdictions. And I put that in there just to make sure you're aware. There is that state statute assigning that responsibility to you all as the elected leaders for the city of Las Cruces. In addition, it then authorizes you to establish a local office of emergency management as the agency responsible for that function, and then subject to the approval of the State Director of Homeland Security Emergency Management. That person also approves that and helps coordinate our efforts across counties. This should not come as a surprise to this body, but sometimes certain aspects of the state government forget that Southern New Mexico exists occasionally, and so we actually have formed a very tight partnership with our surrounding counties and work on a very regular basis, including right now we're assisting Sierra County with the fires that they have taking place. Another interesting statute you should be aware of is that the local governments are directed during a disaster response to utilize local services, equipment, supplies, and facilities to the maximum extent practical, as well as the employees within that local governmental entity. This is basically the state saying their expectation before they give us help is that we have tapped out what we can do locally. Again, I point that out because sometimes we'd like to be able to say, hey, state, we need some help. This is what they expect us to be able to demonstrate before they're going to sign off that we need that help. They need something that says, yes, we've really reached that. And so that's something that if there is a disaster declaration that's needed, that's important language for you to put into that disaster declaration to confirm that to the governor that, yes, local resources have been tapped out. So key points on the legislation. You've got check marks right now for two things. You are responsible for the all hazards emergency management for the city, and back in 2001, passed that to the Joint Office of Emergency Management, and you are authorized to establish that emergency management program. The real key one that we don't have a check mark on right now is really a failure of that 2001 Joint Powers Agreement that really needs to be revised, because we don't have that clearly laid out to meet the statutory requirement of delegating that appointment of who hires the emergency manager, what type of supervision and oversight happens. We don't have things covered like one-off purchases, and you'll see why that becomes important here in a minute. It doesn't cover the addition of another entity like the Sunland Park, City of Sunland Park. So those are some things that we really need to work on a new joint powers agreement with all of the partners here over the next 6 months. We've had good discussion with city senior leadership on that need, and that is actually now waiting on me to get back with them on how we proceed forward. So here are some crucial...
Excuse me, sorry for interrupting. City Manager wanted to kind of chime in on that last comment.
Yeah, I appreciate it. Thank you, Mayor. Just wanted to make note, Eric Enriquez has been our appointee from the city manager's office as the liaison to work with our OEM. So just, I think all the council maybe knows that, but just wanted to make that aware.
Okay, sorry about that. Thank you.
Thank you, Mr. Mayor, and thank you, Mr. Peely, for yes, confirming that. Yes, Mr. Enriquez was thrown under the bus some months back, so. So some crucial elected leader roles that we want you to be aware of. There are a lot of these, but we've pulled out the ones that we think are most important for you to be aware of. If you'd like a listing, the state provides us with a 3-page single-spaced document that lists out elected leader roles. But you know most of your roles. These are the ones crucial when it comes to a disaster. Really, we need you to provide us with what's called policy direction. Tell us where you want things to go. If there's a disaster you don't think we're adequately preparing for, tell us that so we can get on that and add it to our THIRA, add it to our regular meetings, develop a committee if necessary, whatever it takes. During a disaster, we also need policy guidance. That's something that we got a little bit from, and thank you for whoever had the idea of putting together the city task force for COVID-19 vaccinations, because that is a policy guidance board that said, you know, this is what we're looking for as the elected leadership, both for the city, and you had people from the county and others, to give us that, you know, this is the target we want to meet. And by the way, on that, 96.6% of adults within Donand County have had at least one vaccine. That is way better than the rest of the United States. To be at 96.6% is just phenomenal. And 83.5% are at what we consider fully vaccinated. So really good numbers from that. So during a disaster, we really need that policy guidance as well as after a disaster, giving us feedback on, you know what, we were satisfied with that, or we would like to see some better improvements in this area. We heard a lot of concerns about that. Oftentimes it's communication, and we certainly know that that's an important thing for us to make sure we're giving you information that you can then get back out to your constituents. We also need your guidance when it comes to emergency plans and monitoring. You should be holding us to the fire to make sure that emergency plans are developed. And the ones that we say we're going to develop are in place. They need to be approved, and that obviously is going to require a signature from, in your case, Mr. Peely, and sometimes Mr. Miyagishima, but some things may come to you for actual votes, but make sure those things are happening and hold us to the fire that we're maintaining those things. Over the last year, we've started putting a lot of effort into catching up some of our plans that are dated 2011. And as you all know, we've had a little bit of growth in our communities since 2011. We also will need, through the Joint Powers Agreement, some clearly delegated authority of who can speak on behalf of the City of Las Cruces during an emergency or disaster. Who can release information? How do we release it? There are some things that are going to need to come out of the Emergency Operations Center quickly. That's life safety information. Usually, nobody argues over that. That's the ready, set, go of an evacuation, for an example. But other things may start getting into policy stuff, and sometimes we may need the counselor for that particular district to come forward and be willing to be on camera, or at least give us some information that we can release for, again, that constituency, and it may be something that comes back to the entire city council for direction. Emergency funds and spending authority are also one of those things that probably needs to be spelled out in the JPA. Mayor Miyagashima mentioned I was the chief of police at New Mexico State University for a year or many. And my spending authority during a disaster there, I was also served as the emergency manager of the university, and that role was $100,000. That's the entire authority that our county manager has given to him by the Board of County Commissioners. I'm not sure what you give to Mr. Peely, on that without having to come back, but you probably don't want me having the same spending authority they do, but those are things that need to be spelled out. If the fire chief says, we've got something going on and I need you to spend $10,000 on renting a Bobcat and some other equipment, that should be spelled out that, yeah, that's good to go. We'll break out the procurement card and get it done without having to make any other calls. And then incident management and recovery, again, identifying, yes, we've got all those people and they are good to participate. And then again, we need your assistance in communicating sometimes back to your constituents within the community to find out what their needs are and making sure they're aware of the help that's available. It used to be we could post something in a newspaper and reach a lot of people. That's no longer the case. And the social media that I utilize, my 18-year-old daughter tells me, is not going to reach anybody within Las Cruces. So you clearly were elected somehow, so you had a way to reach the constituents, and we may need to take advantage of that. Just a quick update for you on where we've been over the last year. We have participated in one nationally declared disaster, that is obviously COVID-19, one locally declared disaster that was confirmed by the governor to be a state disaster, and that was the August flooding. That disaster declaration covered from the southern border of the county all the way up through and including the city of Las Cruces, because we had flood damage that started here and went all the way down, including the city of Sunland Park. We've done a restructuring of the Office of Emergency Management over the last year. We took one of our emergency coordinator positions and made that into the Deputy Emergency Management position. The Deputy Emergency Manager, again, is Amanda Bowen, waving in the back here. We needed to do that because we really saw during that flood response, we did 96 hours straight in the Emergency Operations Center. And we split it in 12-hour shifts. Amanda covered 12, I covered 12. Plus briefing time, it was really 13 each. And we need somebody, if I'm not there, that has full approval and signature authority that the emergency manager position has. So by restructuring, we've created that now. And if we are able, with that addition of Sunland Park, to get that fourth position, that actually now gives us a team of 2. So we can actually send somebody to the scene to do situational awareness, community lifeline analysis, and reporting, while somebody is running the Emergency Operations Center. So we're actually getting to the point where we have the ability to run a large, long-term operation. We've also restructured our Southern New Mexico Medical Reserve Corps. This was started over a decade ago in the Office of Emergency Management. It's a national program to assist with medical and non-medical needs during a disaster. But we discovered that the state statute requires, before they are covered for liability, that the governor has declared a disaster. Well, that may be 3 or 4 days in after we have already been needing them. And then there are other times when we may want to utilize them that the governor doesn't agree to a disaster declaration. So we are now onboarding those people, transitioning them from just being Medical Reserve Corps people to also being county volunteers so that we can run background checks, give them a county driving permit, because it really helps if they can drive one of our vehicles with medical supplies, for example. And they also then are covered by the county risk management policy, so that they actually have protection both for workers' comp as well as general liability. The VOAD partnership I've already mentioned. We've been very excited that that has stood up, and we're actually utilizing that partnership right now as we support Sierra County. We have obtained significant grant funding over the last year. We obtained the $1 million grant to assist with COVID vaccinations from FEMA. We've received 2 grants worth a total of $55,000 from NACHO, that's the National Association of City and County Health Officials. And then we just secured another $42,997 from the New Mexico Department of Health. So when it comes for budget approval, we're not just taking, we're also finding other sources to help build the resources within our area. And the last one there, the major activities, is we've really started refocusing our plans and our efforts towards community lifelines. During a disaster, maintaining community lifelines and or rebuilding community lifelines. Because if we don't have the community lifelines in place, then the individuals don't have access to the things they need to successfully live within the community. So that runs the gamut from food supplies to transportation to medical to energy, and there's a whole science on community lifelines. But in general, we call it the whole of disaster response. We're looking at the entire community and getting the community that's affected back up to as much of normal as we can. We can't help necessarily every single individual every way they need, but if we can get the lifelines in place, then at least the community has a good chance of recovery. So specific to our planning and preparedness, we have completed our regional THIRA. The THIRA, this is the first time that the THIRA applies to more than just Doñana County. It also applies to Luna County, Otero County, Sierra County. And the reason is, if it's happening to one of them, it's impacting us one way or another. So we felt it was appropriate to actually pull those together. The threats and hazards that were identified now over a year and a half ago were flood, pandemic, hazardous materials releases, a cyber attack, terrorism, and wildfire. And we have gone in now, we've completely rewritten our flood response plan. We're now working on our cyber plan, which has not existed before. So that one's having to start from scratch. Pandemic, we got a lot of practice on. So we are now doing our after action on that and reworking it. We have completed a tactical interoperable communications plan that covers 8 counties in our preparedness area, so that if we are assisting each other, we have the ability to talk with each other. We have improved our flood resource. We have obtained a portable sandbagger based on grant funding and large sandbags. For anybody who's handled sandbags before, you probably have handled the 40-pound version, the small ones that you can stack a whole bunch and stop a little bit of water. We have now obtained some that are 3 foot by 3 foot by 4 foot, so that we can stop large amounts of water. We discovered that the small sandbags can be overtopped pretty easily. The large sandbags really help when we're talking about protecting those community lifelines. We are updating our current plans and annexes, including the development of a mass fatality management for both mass fatalities before hospital treatment as well as mass fatalities that occur at a hospital. And we are spending an increasing amount of effort on monitoring the potential for a migrant crisis. We've all been through the 2019 migrant crisis. We continue to monitor what is taking place, and we do have a short plan, is what we call it. It's not detailed out like we have our other annexes, but it does talk about what our trigger points are, where we would come back and say we need to probably consider declaring a disaster. With that being said, we know that the federal government is very skeptical of a local government being able to declare a disaster on the migrant crisis, because they are putting a whole bunch of federal effort into trying to prevent there from being a crisis. FEMA has front-loaded a lot of resources into our area. They've obtained 51 charter buses, so that if our local NGO capacity is exceeded, that's level 1 or tier 1 response, they will kick into tier 2. They'll bypass trying to hand people off to the NGO welcome centers, and instead we'll load them on buses and get them to Dallas, Denver, and Phoenix, the major transportation hubs around us. Because if the NGOs are backing up, we know from experience it's probably because they can't get plane tickets or bus tickets for people to get out of here. It's not like these people want to stay in our communities. They're trying to get to where their sponsors and family are. So FEMA's plan is, at this point, tier 2 response to really beef up that transportation infrastructure and get people to those major hubs. Tier 3 is where we would look at having to actually call a disaster, because that means that they're just having to release people like they did in 2019 on the street. And at that point is where we would look at, locally, we really need to step things up. On resource building, the county provided us with $1 million to create an all-hazards disaster shelter for 300 people. That is underway. It consists of both congregate and non-congregate capabilities at the county fairgrounds. People often ask us, why the county fairgrounds? That seems a long way away. Yes, and that's one of the reasons why. Because we don't want to put a disaster shelter where it might be impacted by a disaster. If the fairgrounds is impacted by a disaster, well, then it's not here, so nobody needs the shelter. But if it's here in our population centers, we need to be able to get people to a relatively safe place, and it is much higher than the Rio Grande River, especially right now. In addition, it gives us a capability that by federal regulation we were supposed to have in 2008, which is the ability to handle animals that come in with people. The number one reason we know that people do not go to a shelter is they can't take the rest of their family, their animals. By being able to utilize the fairground to the maximum extent possible, we've got the ability to take care of not just traditional pets like cats and dogs. We can take care of the miniature horses, the regular size horses, the cows, the sheep, the pigs, even the chickens. So, it really does beef up what we're able to do. We put this plan into effect last year, and now it's really nice to see it bearing fruit, because the state came down and did an overview with us a few months ago, and then they started utilizing fairgrounds just 2 weeks ago up in northern New Mexico when the same thing happened. So it's nice to see that our concept has actually been tested and is working well. We also have a portable sheltering capability coming out of that, because again, we know that we may not always need to put 300 people at the fairgrounds. We may need to shelter 20 people, 40 people. So we do have 2 large Army tents coming from a local Las Cruces business out on the West Mesa called Alaska Structures. These are really nice, durable structures, complete with heating and cooling. So we can shelter comfortably 20 people per tent. If we need to, we can bunk people and do 40 people per tent. And we can move those anywhere we can stake down. And so we have identified a number of places where they may go, to include city parks, school grounds, and other spaces that also provide some good opportunities for people for mental health care. Because if you're having to live in a disaster shelter for a while, the ability to go out and just in a green space and walk around and enjoy some grass and trees really does mean a lot to people. It also allows us to take into account access and functional needs. Most of our shelter plans up until last year centered on putting people in school gymnasiums. We found out in 2019 school gyms are terrible because there's school. And, the school has plans for those gyms. It's not like they built a big, huge empty space and didn't need it. So they need it for their regular activities like PE classes. They need it for whatever events they have taking place. So it just wasn't ever a good plan, and it really didn't meet those access and functional needs. So by being able to develop a non-congregate capability, people who have special needs like not being around a whole bunch of other strangers will have that opportunity. The county has also provided us right now with $480,000 for a new OEM EOC building. We also have secured another $1.5 million from Congress. We're going after much, much more because the building's going to cost a lot more. We're looking at roughly 25,000 square foot building on a roughly 10-acre site. We have the architect selected right now, and we're under negotiations, and we'll be taking a contract to the Board of County Commissioners hopefully within a few weeks to solidify that architectural service and start the formal design. We are down to 3 sites. 2 of them are in the city of Las Cruces. 1 is very close by, and 1 is owned jointly by the city and county. So if that emerges based on the architect's assessment as the top site, we're hoping that this body will agree with the county to allow us to put that facility at that location. I'm not going to specify where it is because other people may decide to start buying up land around it in anticipation. We'll wait for the formal process to go through, but hopefully that's something that we'll be bringing back soon. The county also provided another $127,000 for Web EOC, which is a cloud-based software package that allows us to share information among our first responders, among our elected officials. That software is currently being specialized, customized for us right now. So by mid-June, we hope that it is available and we can start rolling out some training. And we also received another $95,000 for some new vehicles, radios, and trailers. So those are resources we've been building. Within that portable sheltering capability, we also are getting light tower trailers and portable generators that can be utilized outside of just the portable sheltering. So if we have a city facility, for example, that suffers a major power failure, but we need to get it back online in at least some level, we'll have a portable generator that may be able to meet some of those needs. Same thing with the light towers. If there's a major disaster and first responders need to work 24/7 and they need supplemental light, we've got those to be able to do that. On the mitigation side, we have done floods, flood mitigation down on La Union. We have an OEM flood committee that is giving us guidance on mitigation, and in fact, we have a meeting with our flood committee this Thursday, which will include a disaster exercise with them, and we are seeking additional mitigation grant funds. We've put in right now for $3.5 million in disaster mitigation funds specific to flooding, and we'll continue going after more of those based on the guidance we get from the flood committee. On cybersecurity, that team has been stood up now for several months. We are looking at, with our future OEM facility, providing a place where our local governments can back up data to so that there is an off-site secure location that will be a little bit resistant to a potential cyber attack to provide some of that assistance. And we are working right now with the federal government on trying to do a cascading failure analysis of our community lifelines should there be a cyber attack. And we are also working with the El Paso City and County Office of Emergency Management, Luna County, and Otero County on a regional supply chain logistics plan, because everything that comes into one of our communities is probably what supports all of our communities. We get it from the same trucks that are serving the same stores. We've had really good participation from companies like Walmart's Global Emergency Management Program on how we can help, or they can help us with a major community response. We're working with Family Dollar. You'd be surprised how many Family Dollars there are in a community. If we can hit the Walmarts, the Family Dollars, and the Albertsons, we've pretty much met at least 60% of the grocery and food needs for our communities. On the response and recovery side, we did have the flooding response. The COVID-19 after action, as I mentioned, is underway, and we are still working right now on the wildfires. Amanda did go up for a week to support the state EOC. She was the very first local emergency management professional that they requested, and so she was up there. After that, apparently they liked it because half of the rest of the state has then been invited up to assist them. We told her we need her back here, though. They couldn't keep her. We are now providing shelter support we provided it to Lincoln County. We provided shelter support out of that 300-person capability that we've built up. We provided the shelter supplies for 300 people to them. Then we restocked, and Las Vegas and Los Alamos requested assistance, and Sierra County, we restocked and ready to support them. So upcoming, and this is our last slide, we do want to continue doing these annual briefings if you find them useful for our elected and senior officials. We need to focus on that JPA, so Mr. Enriquez and I will be very good friends, or not, in the next 6 months. We will be working on that addition of Sunland Park and potentially others to the OEM cooperative agreements. iPause is the national way to put alerts on cell phones. We have that capability right now at OEM, and MRVDA is within a week or two of having that capability as well. MRVDA will be the primary activators of it, and OEM will back them up should the dispatchers be overwhelmed during a disaster, so that we can put out those type of, for example, emergency evacuation notices. The Great American Shakeout, Mr. Ikani Tamapau brought a great idea of utilizing the Great American Shakeout as kind of a regional disaster exercise. It's fantastic. So we are moving forward with that. So on October 20th of this year at approximately 10:20, and so if you're putting the date and the time together, you know, you may have an opportunity to participate in the Great American Shakeout. The Great American Shakeout is designed to be an earthquake drill, but it doesn't have to be, because most of the emergency actions you do for that are the same things you would do for any other disaster. So you'll have an opportunity to participate potentially in one or more ways with a disaster on October the 20th. We are continuing to monitor and report on the COVID-19 situation, and we are working on a new strategic plan, because once we get the OEM building built, we will have accomplished over 50% of what's on our current strategic plan. So with that, I'm happy to take any questions any of you might have.
Thank you, Steve. Councilor Bencomo, Councilor Beta, Bencomo, and Flores, and Gandara.
Thank you, Mayor. And actually, thank you for allowing me to go first, because I do want to say a special thank you to Mr. Lopez and to Amanda as well for all the work that you've done, not only with just the OEM in general, but the work that you've done on the vaccine task force. I think in my experience and for what I saw during this time, your leadership really changed, I think, the direction of how we received communication. And that for me was very important and very vital to be able to make the decisions that we did within the task force and for the community as a whole. And as you've been, I think, so communicative this whole time, even now for this as a work session item, Stephen came up to me and said, we haven't done this. There's now an additional 2 more of you that are on here that haven't had this education. I'd really like to do this outreach. And so I talked with Mr. Peely, and I think that just speaks to what you want to do for building up, collaboration. And that way we have these relationships established. When we have emergencies, we're not necessarily new to each other. We have that base of trust, which you need when we're going into these high pressure situations. And so I just want to say a true thank you and extend my gratitude for that, just first off. So thank you. And that's honestly about it, because I've asked you a ton of questions with these things, but I just want to say thank you. I think it's really changed a lot of that relationship, and I very much value your expertise, the expertise of Amanda, and all that your department is bringing. So thanks. Thank you, Mayor.
Mayor Miyagishima, Councilor Beta, just thank you very much for that feedback and for your comments. We've appreciated working with you over the past year, 18 months, feels like 10 years. So thank you very much, and thank you for your assistance.
Councilor Bencomo.
Thanks, Mayor. Thank you so much, and thank you, Councilor Beta, for the forethought of this work session. I appreciate it. I feel like I learned a lot. I'm not even sure if I had received this information yet. I know that most of our interactions with you had been through COVID, and so I'm glad that we get an opportunity to do this. I do have a couple questions. Just given the realities of the fires in our state, and I'm just curious about the threat Donand County, to our community on that? And maybe that's a question for you, or I'm not sure who could respond to that, but I'm curious about the fire threat. And then, so then there is, through the OEM, sort of scenario planning for like evacuations for how we would respond in the event of a fire, flood, any of those kinds of things.
Mayor Miyashima and Councilor Bencomo, yes, we've looked a lot at wildfires. In fact, we've become intimately familiar with how to look at infrared signatures at 3 o'clock in the morning to see where hot spots are, and that is a skill we did not possess a month ago.
Wow.
So it's been actually beneficial for us. It is a benefit that we don't have as many trees around us as other parts of the state to dry out. We do have wildfires that have taken place here, principally in the Oregon Mountains. The year 2008, we had 2 large wildfires. 2009, we had another large wildfire. 2010, we had another wildfire. 2011, we had another wildfire. And then we've been kind of on pause for a little while. So we are due for another one. We had one just a few years ago up in the Oregon Pass. Almost all of those are taking place on the Missile Range or Fort Bliss property. So they take care of the management of those, and then BLM takes care of things primarily on this face. There are some homes that in the unincorporated area that do get potentially threatened, and we do need to look at the evacuation for them. But it has not been frequent, fortunately for us, because we don't have the large trees. But we are due for some type of wildfire. We did have a little bit of a burn just a few weeks ago down in the Bosque, and that's to be expected. We have those small ones that are in the dozens of acres on a pretty regular basis, because when the river is flowing, everything's growing, and then we turn off the water supply by September, and it dries back out, and it's ripe for a fire. Fortunately, the way that the Bosque is designed or built, our prevailing winds are usually blowing towards the river, so it really gives us a nice big fire break. And the town of Mesilla, backed up by county fire and city fire, are able to usually get that under control almost always within the same day that the fire broke out. But the potential for things to escalate with anything in town, whether that is caused by people who are utilizing a grill too close to their home, people that are trying to fry a turkey inside their garage, or, I mean, there are a number of things that really present fire dangers that our first responders, the chief and deputy chief, can probably speak a lot more to. So I'll provide them with that opportunity to do so. Anything you gentlemen want to add on fire risk? I mean, it is the reason you have jobs, so.
Thank you for pointing that out.
It's in your title.
I'm going to have to ad-lib now. Fire Chief Jason Smith, for the record. For fire danger, when you talk about our wildland-urban interface, we don't have very much or a very high level of risk because of the amount of really roads and just desert. Even though the desert is very capable of running with underbrush and our creosote and everything else that grows in there that's beautiful to look at, it can dry out. But coming up in the beginning of June, we'll be coming to the City Council for a resolution on fireworks, restricting those to paved or barren land. That is probably our next most significant event that we're facing.
Thank you, Chief. I was actually headed exactly down that road, just ways that we can mitigate our own risk here, so that I appreciate that. Thank you so much for that answer. In events like extreme heat, for example, which, by the way, I think we should probably turn on our cooling stations here pretty soon, but I'm just curious, in the event of extreme heat, which seems like the most likely emergency for us, right? Is that something you also have a role in and a plan for?
Mayor Miyashima and Councilor Bencomo, yes, extreme weather is one of our thyroid-identified issues, whether it's extreme cold or extreme heat. The question, and this comes kind of back to earlier in the presentation, talking about policy guidance, this is actually where we benefit from getting information from you all as to at what level you really want us to commit public resources and funds towards responding. Because if you say it's at 105 degrees, we say we call that June.
Right, next week.
Right,
Yes.
So, but certainly most people in our area, not all, some are, especially in the high social vulnerability areas,
Right.
that is taxing by itself. But certainly when we start talking 115 to 120 degrees, now we're exceeding the capabilities of a lot of people in the community, and that may be where we start hitting a disaster level. And at that point, we do have the potential to stand up cooling centers. The City of Las Cruces actually has a plan to utilize senior centers and recreation centers as cooling stations. The library, City Hall, and those make absolute sense. It's much more challenging actually on the inverse, which is the extreme cold. Again, if we get down to 25 degrees, that's really not that unusual. If we get down to 15 degrees, 10 degrees Fahrenheit, we're now well below freezing, and if we're going to stay at that temperature for 96 hours plus, that may itself be a disaster that we need to really start looking at and preparing for. And then our cooling centers don't work out that well because the temperature extreme that's really cold is happening at 3 o'clock, 4 o'clock in the morning, and those facilities are not open. So, if there is that expectation to be able to do some of that, that's where policy guidance from this council can really help us start making preparations towards that direction.
Okay, thank you for that. That's really helpful, and perhaps that could go, I don't know if really any PRC, but potentially health or quality of life PRC could begin having some of those conversations, just because they feel like, if these fires are not a wake-up call for us for climate change action, I don't know what is. And again, I think we have to assess our own risk, and I think the reality of us in a drought and extreme heat, that's a possibility. And so I think that is a conversation worth having in one of the PRCs regarding policy. It seems like today our three presentations were well aligned, and because we just had one on the Crisis Triage Center, I'm curious if you have, it seems like you do an excellent job at collaborating with multiple different kinds of agencies. I'm curious if you've had a conversation with the Triage Center around the kinds of crisis services they could provide. Very much, you said it, right, for people who are in these facilities potentially for a long time, how that could impact their mental health.
Mayor Miyagishima, Councilor Bencomo, the Crisis Triage Center was actually utilized by us before it was utilized by them.
I remember that,
because we utilized
yes.
that in 2019 during the migrant crisis. I was very fortunate in my prior position to have advocated for the development of that Crisis Triage Center, been there at the groundbreaking and then the wait for it to actually get to being operational. Really happy that it is operational, and it is absolutely something that we have listed down as a resource in order to be able to connect people to. We actually, though, start much earlier than that. When we start talking about the mental health, and our VOAD partners have been very instrumental in this. Not only are we providing from the Office of Emergency Management stockpile that the county helped fund, things like blankets and pillows and cots, we actually have things like crayons and kids packs. And it's not just kids that need crayons. It's amazing how many adults will sit there with a coloring sheet just for that kind of mental health break. So we're really trying to provide something early on, provide recreational opportunities early on through our VOAD partners. And some of our VOAD partners do have dedicated mental health capability to bring to the scene. And then through the Southern New Mexico Medical Reserve Corps, one of the training areas that we have identified for this next 12-month period is being able to provide mental health first aid, so that those people, when they're helping us on a disaster, know what they're looking for to identify somebody in pre-crisis, be able to do some interventions, or somebody who is in crisis, recognize it and help connect to resources.
Great. Well, I see the clinical director here, so maybe you can connect. Don't miss the opportunity to connect before you leave today. And then, so just so I'm clear, you now, OEM is the key entity in Donand County that will be sort of the head of if we start receiving asylum seekers again?
Mr. Miyagishima, Councilor Bencomo, no, we hope not.
Okay.
If we are doing our job well, working with the federal partners, and we've been working very closely since January of last year, and with the NGOs, if we're doing our role well, we will never hit Tier 3.
Okay.
It will be able to be handled at either Tier 1 through the NGO network or Tier 2 by getting people using those federal assets out of the community and to those other transportation centers.
That's right. Okay.
So we are hopeful that OEM does not need to be utilized at Tier 3.
Okay.
But if need be, then yes, we are prepared to do so. We've even identified some of the transportation companies that we might be able to utilize because we've assumed that by that point, all the local companies are maxed out. So we actually, Amanda and I, looked at it, how do we bring in people? Deadheading is always the issue. You know, you take a bus full of people somewhere and then you got to turn around and bring it back without any paying customers on it. So we kind of flipped the script a little bit and figured that if we contact people in Dallas and Denver and Phoenix, hire the charter companies there to come pick up, they're not deadheading back, they're coming to pick up their transportation. People are a lot more willing to come get their opportunity to make money than on the other side feel like they're just burning money on the back end. And we think that that's probably a solid plan. We obviously are not at the point of trying to write any contracts with anybody. Again, because FEMA believes that with the 51 charter buses for this region alone, they're pretty confident they can meet that. We've also leaned forward a little bit and pushed them that we know in our conversations with El Paso Office of Emergency Management, the El Paso International Airport is at pretty much max capacity with their regular passenger flights. But we do have air assets here in Donand County, some that you may vote on every once in a while trying to create passenger service for, and maybe FEMA looks at charter service through the 2 large airports here in Donand County.
Okay.
If that really comes to be the need. And then we can work on process and throughput rather than trying to keep people for a day or 2 days or 3 days in a shelter environment. If they release them and we can get them straight on and going, we can work with NGOs on the other end to do that reception and help for them get to their ultimate destination.
Great, thank you. That's great to hear about those charter buses. That's incredible. And I just have one last question, and it may be a little bit controversial, and I honestly don't mean it to. I just, really lessons learned, I think, especially after what we saw in El Paso in 2019. And I know that Border Patrol is a big agency here in our community. However, I think it's important that OEM and all the agencies, when planning for emergency scenarios, that the use of Border Patrol is minimal, or at least very behind scenes, because that will impact the way that our undocumented neighbors are able to receive emergency services. And I say that, you know, they were a big agency in El Paso in 2019, and a lot of people who are undocumented didn't go to the hospital to seek help, medical help. And I wanted to note that and wonder if you've thought about those kinds of things, particularly because of the community we live in.
Mayor Miyagishima, Councilor Bencomo, that's a great comment. And yes, we have thought about that. In fact, my experience with that started in 2006 with the Hatch flood response, because Border Patrol was the first agency there. And they were performing rescues with people, and so we did a lot of outreach back then in my former role, asking people, because we were second there because we had a lot of 4-wheel drives from the university, you know, did that cause you any concern? And the vast majority, it did not. There were some that it absolutely did. And so it was a very sensitive balancing act. But we also were pleasantly surprised that quite a few were happy that their federal tax dollars were helping them. They were pleased to see it wasn't just local government trying to save their lives, that it was all hands on deck. So I think that's a very, very careful balancing act that we have to look at with each disaster. Sometimes Border Patrol is just always going to beat us there first. Sometimes they're the ones, I try to use this carefully here, bringing us the challenge, in which case that partnership is very important, and the optics probably are very different. And then yes, you know, certainly there are segments of the community in some disasters where that's going to be a very big concern.
Thank you so much. I really appreciate it. Thanks, Mayor.
Councilor Flores?
Thank you, Mayor, and thank you, Mr. Lopez. It's wonderful to see you in person. You look quite different. I barely recognized you. And again, thank you so much for your presentation today. You mentioned something about the FEMA coming in case of we have migrants coming in. And I believe you said that the federal government, maybe I heard wrong, didn't want local governments to do anything to that, pretty much to that effect. What exactly does that mean?
Mayor Miyagishima, Councilor Flores, we've had some very frank conversations with elected leadership in Washington, D.C., and they know that if local governments have to reach a level of declaring a disaster over the migrant situation, that it will reflect in a particular way on those elected officials in Washington, D.C. So they are trying to front-load resources and plan so that it never reaches that level. I'm hopeful that their plan is going to work. It's a published plan. It's 20 pages long. And for the most part, it looks very good and is very much in line with exactly those 3 tiers I just described to you. But they do acknowledge that third tier does exist. It's only 1 paragraph out of 20 pages, but they do acknowledge there may be that time in which we reach that level. And that's, for us at the local level, important to recognize where it is, because if we start expending our local financial resources, if we haven't reached that level, the federal government agrees, yes, this is beyond what we can do, our ability to request federal funding for reimbursement really goes down. So, for example, the federal government put a lot of money into the Emergency Food and Shelter Program, the EFSP. And out of that, over $6 million has been given to NGOs in Las Cruces, specifically to aid in developing capabilities for migrant welcome centers and reimbursing them for those expenses on a per-head basis. So they're really trying to do everything they can to keep that network functioning as much as possible so that they don't have to hit Tier 2, much less Tier 3.
Mr. Lopez, so have you seen those plans that they have? Because my fear is that any government, local government, for example, sometimes moves slower than molasses on a cold day in January. So is the plan that they have, which they want to implement to assure that the local governments don't go ahead and do stuff, is that pretty well defined? And my concern is that they didn't come through last time. And they knew pretty well. We all know very well. They knew it was coming. So, we might be caught between a rock and a hard spot when push comes to shove. And I don't want to be in a position where we're going to be fearing lack of reimbursement and not helping people that need help. So is that pretty much in place, or is it hard to tell at this point? And then FEMA? FEMA, really?
Mayor Miyagishima, Councilor Flores, yes. So FEMA was specifically tasked by the White House to get together, and what they have done is they've created regional points of contact, regional directors of the response, and in our area, that is actually the Border Patrol chief for the El Paso sector. So she has the responsibility of managing that all the way around, so she knows that if she starts releasing people on the street, she's actually saying the federal plan is no longer working. So she is motivated to keep that working. Now, there are people within DC, within elected leadership, that think that it's insufficient. And there are people who think it's too much, which is probably a pretty good sign that it's at least adequate when you've got people on both sides. I have seen the plan. I can certainly send that out to Mr. Peely, and he can disseminate it to the City Council so you can see the plan yourself. It is very reasonable, and the fact that they have front-loaded that money into the EFSP program for the NGOs, the fact that they have contracted already with additional transportation assets is very encouraging. I agree with you. We never want to let the federal government, like the state government told us in 2019, don't declare an emergency, we'll just kind of manage this. If we need to declare an emergency at the local level, we need to declare it and we need to make it public. We need to hold the other levels of government responsible for helping us out, because this is not something we have created, and we need them to step in. They've got, at the federal level, the responsibility for managing migration and enforcing whatever laws and rules and hearings that take place. So we absolutely need to hold that level accountable if we need to. The caution is simply we don't want to start expending funds expecting we're going to get reimbursement. If we need to expend funds and we're not going to get reimbursed, and that's the decision made by elected leadership, I'm right there with you.
Great. So Mr. Lopez, so along those lines, at what point would we be in a safe position of making that decision? How far along? Would we wait till we have 19,000 people in the city, or do we wait when we know that people are coming? And will the federal government recognize that it's time to move it? Do you know?
Mayor Miyagishima, Councilor Flores, no, we would not wait until there are people actually on our doorstep. And fortunately, because of the three-tier plan that they've put in place, we will actually have a pretty good indicator when they go to Tier 2 that we should be prepared for Tier 3. At this point, they're still in Tier 1. They've kind of hit the threshold on it a week ago Sunday when they had to release 100 people. And there was a lot of fear that today they might hit Tier 2. However, with a federal injunction on Title 42 in place, the injunction took place starting on Friday, it's likely that we are not going to leave Tier 1 anytime in the near future. So that's basically our trigger point looking for Tier 3 is if we hit Tier 2 level, it's time for us to bring all of our elected government officials or at least city manager, county manager, et cetera, together and start talking about how we're going to manage Tier 3.
Great. Thank you so much, Mr. Lopez. Thank you, Mr. Mayor.
Yeah, before I get to Mayor Pro Tem, Councilor Flores, let me just share this with you. And I think Steve was aware of this, but ACM Enriquez and myself were on a conference call last week with Chief of the Border Patrol. And so what the plan was, and it's along the lines of what Steve was saying, is if you think back in 2019 when the migrants were dropped off here and then we had to scramble, we had to put them different places, we had to find volunteers. When we couldn't find them, we had to hire temps. The federal government feels that that didn't work that well, and it didn't. And so instead, they have, as was mentioned, buses lined up, I mean, a lot of them, ready to take them to the travel centers where they want to go, the big cities, the Dallases, the Denvers, and then they may either stay there or they go to wherever their sponsors are. So what I had told them and what I had committed as a backup, if they run out of, if Border Patrol or something was a run out and needed a portion, I figure our portion is at least 10%. So to at least pay for those buses to, instead of them going here, getting a day and then going back and then flying out, if they have buses that are going to take them from El Paso right to Dallas, just go right there. And they're good. They're good with that. And so one of the questions I was going to verify with Jennifer was, I think it covers it, but that emergency ordinance that council passed back in 2020 or 2021, I can't remember, I think it's 2021, we should be able to allow me to use that if I needed to. And so, and then the last question is, what do you have against FEMA? You know, I used to be the national council member to the director, and you know, it's.
I read the newspapers.
Okay.
FEMA. Really?
Yeah.
Okay. Well, I'm very happy that you're happy with FEMA.
Although I'm not.
I'm only speaking from what I read.
Okay.
I read.
Okay. Yeah. Good. All right. So with that, we have Mayor Pro Tem.
Thank you, Mayor. Thank you, Stephen. It's so good to see you. I, too, am very grateful for your work and your leadership. I can't tell you how wonderful it was to be a part of COVID-19 task force and have, the communication flowing, amongst you and others. And so I really appreciate you. So I've often asked this, who's your superior? Who do you report to? God? Yes.
Mayor Miyagashima and Mayor Pro Tem Gondwana, yes, that really depends on where you're looking. If you're asking at home, my wife will tell you it is her, by no doubt. If we're talking in church, that's a totally different answer, but my wife is second. But the who I report to on an administrative regular basis is the county manager.
Okay.
That did not used to be that way. That changed last year. It used to be to the county fire chief, and last year the county manager saw the benefit and need to move the reporting directly to him so that we were closer to both the decision-making ability as well as to the elected officials.
Great, thank you. I appreciate the clarification. When I first got elected, I attended the National, NALEO, the National Association of Latino Elected Officials. They have an emergency management training. It was in the region and in El Paso. And I found it extremely, just very informative, right? And so I would recommend that if council members have not done it, that there are a few, like NALEO or NLC, the National League of Cities, that have those kinds of trainings. It just puts you into that frame of mind, considering all that's out there related to an emergency. I just learned so much. So my next question was going to be along those lines, and then I saw that you have the training that you're wanting to do with elected officials. Would that fall into what maybe the similar type of training that's offered by those organizations, Stephen?
Mayor Miyagashima and Mayor Pro Tem Gondwana, first let me go back a little bit and say thank you for your comments about the COVID-19 task force and the communication. Greatly appreciated there. And for a second I thought you were going to say you appreciated COVID-19, and I was getting a little worried. But the task force absolutely worked well. Yes, the training that we are looking at being able to offer is very much in line with some of what you've talked about. We are actually actively discussing, as soon as we can get that next person on, and the hiring, the posting closed last Wednesday, so we're just waiting for HR to give us the names so we can schedule interviews. And one of you on this committee is going to be on the interview panel, and I'm not going to out anybody, but listen to the nervous laughter. As soon as we can get one more person on, then we're going to really start looking at offering training through the New Mexico Municipal League as well as through the New Mexico Association of Counties. And Amanda and I are both in the process of being onboarded by the state as adjunct faculty of the state to teach a variety of incident management courses. So we'll be able to offer that locally without having to go, though I don't want to discourage anybody from taking advantage of a travel opportunity if you can also learn while you're there.
Yeah, no, thank you, Stephen. I think that's an excellent idea. I thought it was very beneficial because you're with other elected officials from rural, urban, and really as the borderland, right? We're in the border. That I think it's important to build those relationships and understand from a regional standpoint what emergencies constitute and what the various municipalities and counties can be doing related to those emergencies. It just gave you just a really good view of those kinds of things. So I'm glad to hear that we will be having that training. I think that's excellent. And then in that training, I'm familiar because I worked a few years at Department of Health, the tabletop, events.
Exercises, right.
Yes. Are you considering those? And if so, what could we experience or look forward to?
Mayor Miyagishima, Mayor Pro Tem Ganda, yes, the exercises actually follow a pretty standardized process that start off with a seminar or workshop at the low end that gets everybody kind of familiar with the concepts and with the plan, and then you build that into what we call the low functional exercises like drills. And so we're going to be working with the Great American Shakeout. That'll be very drill focused, followed by, if we're able to pull this off, a tabletop exercise. So that will all take place that day. And then based on that, if it goes well, we'll build the next year to the higher level, which will be functional exercises, where we really exercise larger components all the way up to a full-scale exercise. But normally we are going to have in process at any given time at least 2 or 3 lower level exercises while we're working towards a big exercise.
I appreciate that. And then, Stephen, lastly, the plans that you made mention, the strategic plan, the other emergency plans. Now, do they vary from type to type, like active shooter, fire, wildfire, those things? And if so, where can we find those? And is there like a shared drive where a counselor can access that, so I have an understanding of what they look like?
Mayor Miyagishima and Mayor Pro Tem Gandara, yes, we have what we call the basic all hazards plan, and that covers anything in the general, how we're going to operate and what we're going to be focusing on. And then we have what are called our hazard-specific annexes, and the hazard-specific annexes are those things specific to one particular type of incident, whether that's flood, whether that's a large hazardous materials spill, whether that's a large cyber attack, or whatever. We do not have a hazard-specific annex for active shooter because the police department will most likely have the situation resolved from the active shooter standpoint early on. That is, correct me if I'm wrong, Chief, that's the goal. Within minutes, if not seconds. They train very heavily on that, and they have their own specific plan. The fire department over the last few years has been integrated into that to work on forming up with police department personnel medical strike teams and rescue task forces to be able to go in and pull people out. So we don't need to have a hazard-specific annex just on that. Instead, what we have is that mass care, mass fatality incident where those plans start to come in. If we've got a lot of people who did not make it, then the mass fatality may be something. But we are working very closely with our hospitals. We actually had 2 meetings last week talking about kind of the next steps, and we've been meeting quarterly with our first responders, what we call the First Responder Advisory Group, to see how we can really evolve for our county, specifically when it comes to active shooter, beyond what has happened in other parts of the country. And I'm going to use El Paso as an example. They've told us we can talk a little bit about it. El Paso, when they had the Walmart shooting, leading up to that, had done a fantastic job of planning and training and exercising. And they worked on a triage system where they would put triage tags on every single patient. In fact, every Tuesday of any given week, they had what they called Triage Tuesday. Every Tuesday, every patient got a triage tag just to practice that process. And on the day of the Walmart shooting, not a single triage tag was put on any patient, because the reality became it's about saving the lives, not putting a tag on somebody. And they all did a fantastic job doing what they needed to save as many people as they could. And that really started changing the dynamic when it comes to an active shooter response of trying to do triage at the scene versus the reality of they may come in an ambulance, they may come in a fire department squad, they may come in the back of a police car, they may come in the back of a pickup truck to the hospital. And really, the place that we may need to do the triage is at the hospital rather than at the scene of the disaster. So those are some of the discussions we're having now, and that's kind of an example of how a hazard-specific plan can really change as we learn things from the actual world incidents.
Yeah. I appreciate that, Stephen. I do. I just, even in some of those those times when some of the schools are shut down, right, that we're receiving calls, texts, instant message about, my school is on lockdown and do you have any information? And often, the answer is no. Because really the communication might be happening with chief, with the superintendent, but I have felt that, and I know there's reasons why, believe me, I've been in enough of these situations at my other job that I understand why sometimes you don't communicate a lot of things out to the public. But I want to make sure that as city councilors, we have what we need to be able to, give information to our constituency so that they understand how to respond or know that their loved one is safe or whatever that is. And, I feel like I'm thinking there isn't a shared drive where those plans are. So I'm recommending that there is some sort of shared drive where any of us can go in and understand what that plan is, at least the basics, and that someone from the public can do so as well. And I don't see a lot of that kind of information sort of being, shared regularly. And I think those things are important. And I think we're all sort of thinking about, what if a wildfire happened here? What would I do, and how would I direct, constituencies, let alone my family, to a safe space? So I'm thinking of those along those lines, and I think to me that's important that we know how to communicate with our constituency, how much to share with them, what to share with them, all that. So thank you, Mayor.
Mayor Miyagishima, Councilor Gondara, just to kind of follow up on that. So there is a place you can find some of that information right now, and that's the Donand County website, but it has not been maintained. And I think this is probably a really good time for us to talk about whether it should also be reflected on the city's website, the City of Las Cruces. I think it would certainly make the information much more available. There are some components of those plans that cannot be made public, such as the cell phone number of the chief. He doesn't want those calls at 2 o'clock in the morning. And at the same time, we don't want to put out our cyber attack plan, because I know somebody from another country will download it quickly and then use it against us. But there are absolutely parts of it that are public, and it's great if the public actually accesses it. When it comes to, I'm glad you really brought this up, because it's something that I glossed over real quickly. One of our changes in our office structure and how we respond to incidents is we're shifting a little more towards what's called the incident support model. For many years, it was all about incident command, incident command, incident command in the Emergency Operations Center. And yet at the scene of the incident, it was incident command. And you ended up with 2 operations section chiefs, 2 incident commanders, 2 logistics chiefs. And well, that just really creates confusion. If incident command at the scene has it, the EOC really should be functioning in what we call now, starting in 2018, the incident support model. We shouldn't be trying to direct what happens at the incident. We should be facilitating a number of things. And I think, kind of to your point, the very first thing that's identified in incident support model is situational awareness. And that really is, we send somebody from the EOC to the scene to gather information that can be shared back so we can share it with others, so the chief isn't getting 100 phone calls from everybody that does have his cell phone number already. And we can actually put information up, whether it's in web EOC or directly shared, to the senior and elected officials, so you know what's going on. And we'll clearly say, this is able to be shared, please do not share below this. So that at least you're aware of what's going on, and you can tell constituents, here's what I can share with you. I know there is more going on, but I can't share that. We will rely heavily on the incident, whether that is a unified command, an incident command, whatever the command structure is at that scene. They will be the ones who guide, what we can put out. But at the same time, they may not know what we're doing on the back end side, such as setting up a reunification center, setting up some of the mental health components towards recovery, and those things. So at the same time, that person on the scene can them know the other components that are working in the background, so they also have situational awareness of the big picture. Because to be honest, the first 2 hours, 3 hours of an active shooter incident, they're going to have way more work than they have bodies to manage. And they're still going to be busy for weeks afterwards. So, Chiefs, anything you want to add in on that?
Thank you, sir. Fire Chief Jason Smith. Mayor Pro Tem, I would use this as a time to advocate for City Council and City Administration to take the ICS classes that are geared towards your positions, to start to understand the way that the ICS structure will work and how we function on scene, because I really do appreciate Stephen's comment on the support function. It doesn't, when we're having an incident or there's a declared emergency, who we report to doesn't matter anymore. You could have a firefighter who is incident commander of a scene, or you could have the fire chief, Lord help you. But if we have that base education and that experience amongst ourselves that's shared, we'll know how to fit in. And when we have those PIO discussions or releases, it'll help you to understand why we're not sharing everything. So take Stephen's class.
That's why I've said those classes are very important, because it delineates all of our roles. Very specific, and it's not what you think either. Yeah. And so please, like I said, NALEO and these other NLC, there's very specific classes, Chief, that you're speaking to. If you have a, schedule of those classes, please share with us. I think they're important. I mean, I did it 6 years ago, so I'm very familiar, but I also spent 10 years at the health department where we did a lot of this as well.
And there was another question from Councilor Bencomo about what exactly is ICS. So to put him on the spot, I'm going to ask Deputy Chief Justin Allen to jump in there. He's sitting there, so it's...
Deputy Chief Justin Allen for the record. ICS system is the incident command system that was put into place by the National Fire Agency
1972?
Yeah. So it started out with the Wildland Fire Service, and then it has morphed into what we use on a daily basis. Our crews use, they arrive on scene, they'll establish a command if it's a multi-unit response, and then you can upgrade it and expand it as needed, or scale it back as needed as the event evolves. So that's what we use on a daily basis. It's very ingrained in the fire service as well as the Wildland Fire Service, and we also integrate it with OEM as well.
Anything else, Mayor Pro Tem?
No, Mayor, thank you so much. Thank you, Stephen.
Yeah, Councilor Coran.
Thanks, and I will be brief. I just really wanted to thank you for bringing this, and I sort of wanted to give a pitch to my colleagues. I worked for the Red Cross, where I became the EOC liaison for the VOAD folks in southeastern Virginia, and the reason I'm giving this pitch is in part to emphasize the importance of local leadership. When we were there, us marginalized, I would say, in every decision-making process. And for all of it was a very hurricane-prone place. And if there were a Category 5 hurricane, everyone in our entire region would have to evacuate, all of the people. Something like 600,000 people total in the region. And it would take 72 hours for those folks to evacuate if we reversed both lanes of the freeway. And at that time, the governor said, I will never reverse both lanes of the freeway because that would possibly affect the commerce that we might receive from your part of the state. So don't expect me to ever help you. I will never do that. So it was really just up to the local leadership to put the priority on the people who were there and constantly in danger of this pretty serious risk and disaster risk. And so I just want to say thank you for encouraging us to think about this and giving us opportunities of how we might engage in this type of decision making, and also find places where we can sort of have the moral clarity to say we're looking out for our folks because that's who our constituency is, and not just defaulting to the state to sort of tell us what that is, because that experience certainly let me know that you can't trust them to look out for your folks. So that was my story.
All right. So thank you for that presentation. But I know a while ago, a few years ago, we used to have something on our phones for residents to sign up for called Nixle. And I don't know what happened to it, but fortunately, EFO and his team got it started again, and I think they're going to be presenting it. I think they're training on it right now, and then we'll be able to allow residents to opt in, and then it'll be an immediate message in case there's an emergency, what to do, and I'm sure we can also work with our other local governmental bodies, perhaps, whether it's the schools or things of this nature. So I think that that's really a good thing. But I do have a question. So in the event, I know it's going to sound silly, but I'm not aware of this. Someone asked me this. I said, I don't believe we do. But, some of the smaller towns that are kind of in Tornado Alley, they have like a huge horn. And I know we don't have tornadoes, although I think last year there was one that was possibly spotted, but or was immediately went away. But other than if we were to have Nixle, what else do we have that could alert those, especially if they don't have a cell phone or things of this nature?
Mayor Miyagishima, you are correct. We no longer have any storm warning sirens. The last system that we did have in this region was owned by New Mexico State University. It was a series of sirens that went around the town, but on a good day you could hear it downtown. Just right across the street here. NMSU learned that the financial investment to put it in place was only a fraction of the financial investment required to maintain a rotating siren system in a dusty environment. So oftentimes when the sirens would be activated, they would be pointed towards Mesilla rather than towards the campus. In addition, the maintenance of the network to those sirens to be able to actually activate them became very cost prohibitive. And the university was encouraged to put those in by one of the public safety professionals when they had extra money. The university no longer has extra money for things, and they really had to do a cost-benefit analysis on it. And in doing that, they decided that rather than having to cut a police officer or a firefighter position to maintain the siren system, that they would just get rid of the siren system and instead invest their money in something that was much less expensive but much more capable, and that was what they now call Everbridge. And the Everbridge system is exactly what you were talking about that the city of Las Cruces has purchased. Everbridge actually services over 50% of the Fortune 500 companies for their mass notifications of all of their employees and customers. It's very capable, and I would encourage the city, once you are comfortable with it, to look at the next evolution. You're talking about it being subscription-based, which is exactly what Nixle was. However, as a city government, you do have the ability to utilize iPause, just like the Office of Emergency Management and MRVDA have. Now, right now, we can activate an iPause message for you, and iPause allows us to draw a geographic boundary and activate every single cell phone within that geography. And not just activate it right now, but make it a perpetual activation for the duration of the emergency, so that if somebody drives in after we've already issued it, they get it when they cross that geographic boundary, which is very important in a mobile society, that we have that perpetuation of the emergency signal. Everbridge is one of the systems that is capable of having iPause integration. We'd be happy to assist the city team whenever you're ready to make that or consider that next step of integrating iPause so that you can actually be cleared to do iPause activations, and happy to guide you through that process, because while subscribers are great, and for some notifications you want to just focus on people who are willing to subscribe, sometimes you just need to hit everybody. And the old days of sending it to their landline phones, I think my parents and maybe 8 other people in Las Cruces are the last ones with just landlines and no cell phone. And trust me, I'll call my parents, and they know the other 7. So, yeah, I think it's really a capable platform that you all have obtained, and we're happy to help you grow that if we can.
Yeah. My mom has a landline too. But I was going to just say, so this iPulse sounds very similar to the Amber Alert. I mean, if we had that Amber Alert, I think that's all we really need in the event of a citywide emergency, which fortunately we, knock on wood, haven't really had one. I think that's, but so if we were to still continue with the Nixle, but then if it became apparent that we needed something of this nature of iPaws, I think it'd be good to have that ready as a backup just in case. I think would probably be a good thing.
Mayor Agashima, absolutely. And the Everbridge Nixle system can activate iPods from within it. So whoever's activating it on behalf of the city can choose which level of activation you want to utilize. And you're right, it sounds a lot like Amber Alert because Amber Alert utilizes the iPod system also.
Yeah, because you can hear that thing. Everyone's phones go off.
Everybody's phones.
Okay, well, I think this was very
informative.
Yeah, very informative and very important, and thank you for all that. I will say that I don't recall signing a succession plan lately. Usually I do it every year. Someone gives it to me and I sign, so I don't know if it's our fault or if someone needs to get it to us.
July 1st, Mr. Mayor.
July 1st, okay. All right.
This thing's on it.
Okay, so I think this pretty much concludes our presentation. So you got your good hour and a half in. So
Thank you very
I
much,
guess you were
everyone.
going to get that. You waited here so long.
Thank you.
Thank you very much, Steve. Okay, I think that's it, Ifo. So if there's nothing further, entertain a motion to adjourn.
So moved.
So moved.
Second.
Motion made by Councilor Beta, second by Councilor Bencomo. You're out, Councilor Flores. Christine?
You hurt my feelings all the time. You're
Yeah,
so
okay,
mean.
yeah.
Big mean.
Councilor Flores. Christine.
Oh, you're flustered. Oh, my God, I've never seen you.
This is on the motion to adjourn the work session. Councilor Abeyta?
Yes.
Councilor Graham?
Yes.
Councilor Bencomo?
Yes.
Councilor Cran?
Yes.
Councilor Flores?
Huh? What? Oh,
To adjourn.
no. Of course. Yes.
Councilor Gondeta?
Yes.
Mayor?
Yes. Okay, it's 5:02 p.m. We are adjourned. Thank you.
Notice I'm very silent.
Yeah, I
I'm
know.
just sitting here. I'm not saying anything. Yes.
Ready for the agenda setting meeting? Okay, this is the agenda setting meeting for our June 6, 2022 City Council meeting. Number non-consent,
1 non-consent,
2 non-consent,
2 non-consent,
3 consent,
3 consent,
4 non-consent,
4 non-consent,
5 non-consent,
5 non-consent,
6 non-consent,
6 non-consent,
7 non-consent,
7 non-consent,
8 consent.
8 consent.